Members, I declare the meeting open to the public online to Fáilte Rómh a Lig. Can I welcome all of the members who are participating by video conferencing today, and also remind members about the protocols regarding the use of electronic devices. I will now invite the Clerk to outline what the Committee agreed during the closed session on the Health and Social Care Board Bill. Go ahead, please, Clerk.
Thank you, Chair. Just to outline, the Committee agreed that it would bring forward amendments that would provide a legislative power, placing statutory duty on the Department to bring forward regulation on the new integrated care system or framework to be laid in the Assembly and approved by affirmative procedure. The Committee also agreed that it wished an amendment to allow the local commissioning groups to continue until those regulations were approved by the Assembly.
Yep. Thank you, Clerk, and thank you, members. Okay, members, moving on then to apologies. We have, I don't think, full attendance this morning, and in terms of Chairperson's business then, a number of items that I want to touch upon. First of all, just to report back on a very successful Patient-Client Council event on the organ donation bill last night. It was one of our engagement events with people who have had experience of going through the transplant process. I thought there was hugely significant learning coming from it, I have to say. Very useful at this stage of our consideration as we go into the more detailed views, and I look forward to the additional event. And I want to thank each and every one of the attendees and members who attended and contributed to what was a very, very rich and useful session. Pam, did you want to say anything in relation to that?
Sure, thank you. Just to say, yes, it was a very useful event. It was good to hear from very interested parties, people who had received organs and or had relatives who they had lost through wait for an organ, or indeed had had transplantations and since passed. So it was very useful. I think there was some very constructive stuff coming out of that in terms of how we could better promote organ donation as well. So I thought it was very good.
Yeah, thank you. Okay, members, in relation to the continuing healthcare, and I know this is an issue that has and is a very an issue of great concern to many people, and the committee has expressed its concerns. I know we did respond to the consultation back at the time that came out, and the committee had asked for further details. But would the committee be content that we seek an urgent written briefing from the department in relation to where that issue is at the present time, how it's impacting, and that we would ask the clerk to write to the department and seek an urgent written briefing on continuing healthcare? Content. Thank you, members. Sure. Jonathan? Yep, go ahead, Jonathan.
Sure. Yeah. Could we also request within that we're given the detail as to how continuing healthcare was applied in times past? Because I think one of the most concerning parts of this, and I know Paula has hit on this point as well, is whose duty was it to inform patients of continuing healthcare? I think that's something that I think we as a committee need to tease out, and perhaps specifically asking for that would be useful.
Yep, members content with that addition? Content. Yep, thank you.
Chair?
Yes, Paula?
Thank you, Jonathan. Just to follow on from that, I suppose the question I asked the Health Minister in the Chamber this week was whose responsibility it is to conduct the assessment, and the response, I know it was a busy day, but I didn't get a direct response to that question, because it came to me subsequently that it should really be a multidisciplinary team who would conduct that assessment. So I think we need more understanding as to what infrastructure in terms of human resources is in place to take forward those assessments. So there's quite a bit to that. I wonder, is that something we need to not just get a written briefing on, but also a proper presentation on?
Yeah, and I think absolutely it also links into the huge issue around the more general transformation of adult social care. We have the true cost of care and the ensuring that there is no postcode lottery existing out there. But I think as a first step, we should definitely get an urgent written update, and we can see where it's at then. Okay, thank you, members. And moving on, members, then to an issue that I have had increasing correspondence and calls on in relation to pressures within the health and social care system. And I have to say, I have never seen the level of concern that is out there among staff. They're struggling to cope with what's being put in front of them. They're struggling to cope with the levels of COVID that are circulating in the community. and all of the other winter pressures which we know are imminent and we have heard in this committee are potentially coming down the track as we move into the winter pressures. If we take the system, and we know it's a complex and a very interconnected system, we take the system right through GPs struggling with a lack of GPs, struggling in some cases with out-of-date or antiquated phone systems, the stalling of the multidisciplinary teams, which would have offered additional support into GP practices. Then you move on from that to where people then are forced into going to emergency departments, also overstaffed. We hear reports this week of one patient who was 6 days in an emergency department before he was admitted to the hospital bed that he clearly needed. And those staff in that system are struggling to cope. Then, when admitted to the hospital, we have nurses who are working in a system where huge numbers are out in terms of isolating. We have gaps, including gaps in the workforce in terms of vacancies not filled. Nurses are picking up on that. I am also hearing significant concern about nurses having to do other roles as a result of, for example, portering or cleaning storage areas. Valuable nurses who we cannot afford to be diverted from their core work. And yet, and we know you can't recruit nurses overnight, but you could ensure, or you could recruit people who could deal with some of that support work and take some of the pressure off nurses. Then we move forward to where someone gets the hospital bed. If they need surgery, we're aware that surgeons are not getting the capacity they need to carry out the surgeries they need. And then you move even further through that after surgery has been got. Discharge then is being impacted with a lack of community nurses, with a lack of social care packages. We see currently 114 outbreaks within care homes, and all of this is adding up to a perfect storm. And I get a sense of a staff cohort right across the board who are dismayed. They feel that no one is listening to them, that no one is hearing what their concerns are, and crucially that no one is acting to acknowledge and address those concerns. So if members were content, I think that we should call on the Minister to urgently convene a summit or a meeting with the colleges and the unions who represent these workforces and who know what the concerns are, and to acknowledge the concerns and to address them. I think it's crucial that takes place. I have to say there needs to be a focus on it urgently, or we are going to be in serious difficulties going into the winter. And for all the goodwill of our staff, and we have seen extraordinary commitment from them, they just simply, I get a sense they simply cannot keep that going forever, and the pressures are continuing to mount. So would members agree that we write to the Minister and ask him to urgently convene that meeting and to address those concerns?
Absolutely, Chair.
Yep, members agreed. Thank you. Okay, members, so moving on then to the draft minutes. I refer you to draft minutes of the meeting of the 9th of September at tab 4.1. Are members content with those minutes? Yep. And then moving on to a matter arising. There is one matter arising then, and refer you to the Clerk's memo at tab 5.1 of your pack, which contains a proposal in relation to the pay offer for health workers put forward by Jerry Carroll. So, Jerry, do you want to comment on that?
Thanks, Chair. Thanks, members. I mean, the motion is pretty self-explanatory. Health workers have worked through hell and high water throughout the COVID pandemic, and we're forever indebted to them. And it's therefore extremely concerning that they're being offered a 3% pay offer. A nurse messaged me yesterday, Chair, saying, and I'm quoting her, "Most of the girls are leaving, planning to leave, young sisters in tears. I have 25 years in the trust and I've never seen it as bad. There's just no time to do things properly. All rushed, and girls are scared of making a mistake." And that kind of refers to some of the points that you previously made. It's a reality for health workers today. 3% is obviously below inflation. Yesterday's announcement is inflation is above 3%. It's set to rise further at the end of this year and next year. And 3% as a pay offer is well below the 12.5% or the 15% or the £2,000 outright payment the unions are demanding of different demands. And I think if we truly value our staff, our health workers, then we'll have to say that this pay offer is not enough. They're worth more than 3%, and I would like to ask members to support the proposal. Thank you.
Okay, so I will come to members for a view on that. I do have to say there's a lot within the motion that I completely agree with, including the value of workers and all of that. I would have a concern around the fact that the motion as worded would actually be blocking a pay rise, and I know in discussions I've had with unions and ongoing discussions that there are, to me, that decision to me is one for workers, and I think that we need to be very careful that we don't do anything that would form a position here where we would be denying a pay rise to workers before they would have had a chance to assess that or do, look at that. So take a view from members then. Any other thoughts? Or Carol and then Paula? Okay, go ahead, Carol.
Sorry, there's a bit of a delay. Sorry, Chair, and thank you, everyone. I sympathise for the principle of the motion, and I don't think anybody, well, I'm sure most people would agree with it, the principle of it, but I do share your concerns. I met with Unison this week. I've been speaking to people from RCN, RCM, and some others in the Royal Colleges, and indeed the allied health professionals. So I do accept that all staff need far more money than what they're currently getting. I believe an increase in pay would be genuinely a mark and I suppose an effort to properly recognise and value staff. Like Jerry, I spoke to a nurse on Monday, and she's for throwing the towel in, and indeed also spoke to social workers as well. And they're basically saying that they're just absolutely burnt out and running on empty. And that even when they go to their line managers or go to, directors or whatever, if they're sent literally in tears and in bits, in some cases, the responses haven't been forthcoming, the support hasn't been forthcoming because everybody's under extreme pressure. And indeed, on one occasion, a couple of weeks ago, someone in social care was asked, well, if you do resign, what hours can you give us in bank? Now, that's completely ridiculous and it's not fair. And it all comes back down to not only a lack of proper workforce planning for a long time, but these positions in terms of pay, particularly given the work and the commitment that our health and social care staff have provided to all of this pandemic. So rather than just voting against the amendment, Jerry, because I don't want to do that, or your motion, I'm just looking at this and I would argue or propose that the committee, this is a bit scrappy, but I would propose that the committee calls on Minister Swan to engage with health unions in relation to a fair pay uplift for all health and social care staff, and calls on the executive to seek increased funding which is necessary from the British Treasury. And then you because one thing unions were very clear, Jerry, and I know they spoke to you as well, that they have leads, they've got devolution groups, but they've also got leads on payment and bargaining. And I want to ensure that they have complete flexibility to do that. But for them, their jobs to be better, we need to argue for more funding. So that's basically what I'm proposing happens.
Can I just clarify, Carol, are you suggesting that the last paragraph be replaced by that amended motion, but that the first three paragraphs remain as is? Is the final paragraph you're proposing to amend?
Yeah.
Okay, I have Paula, then I have Alan, then Jonathan.
Thank you, Chair. Could you repeat where the wording of this motion is? I can't seem to see it in my pack.
It's on matters arising, Paula, 5.1.
26.
Right, okay.
Matters arising.
But in terms of the competition and suggestions, I'm fully on board with that. I think that it is so counterintuitive that if we're not paying our staff the right amount of money, then they will go elsewhere, and that's where the vacancies are created, and then they're having to pay over the odds then for the bank staff and locums, etc. So I think that we do as a committee need to really grasp this. But I'll have a proper look at the wording now and come back in again, Chair. Thanks.
Okay, and I will go then to Alan.
Thank you, Chairman. Chairman, yes, like yourself and like Carl, I would have concerns over any wording in the proposal to block the 3%. I think that would be wrong. I'm not sure that would go down well, or it would be doing the nurses a service. I think we'd be doing them a disservice actually in going down that road. I know that the Minister is on record that his department had budgeted for an increase in the nurses' wage, but there is top-up money required, and I think that the Minister is waiting on the October monitoring round to find if he's going to get, if the Executive are going to grant him that extra top-up money to make it up to the 3%. So even at this stage, the 3% is not actually guaranteed. And certainly in speaking to the College of Nurses recently, 12% was the sort of figure that they were talking about. And I'm not sure of the exact figures. I'm not sure if Jerry maybe has that information, but that extra 9%, I'm wondering what that equates to in pounds and pence. I would imagine it would be quite a substantial sum to find. And I know that I've written to the Minister of Finance just within the last week and asked him if he was prepared to, or if he could confirm that we could ring fence the extra additional money that's coming under the Barnett consequentials. And he indicated to me that there's £180 million probably coming to Northern Ireland from that 5.4 billion. So I think it would be very difficult to go back to the UK government and ask for more. They're giving us that £180 million to assist. It's supposed to be to assist with our health recovery. But the Minister, in his reply to me, he had said that he basically wasn't in a position to ring fence it. It would be an executive decision. I understand that, but he said that he certainly would be supportive of allocating that money to the Department of Health if it was required. But I don't think there's any doubt that it is required, and that the Minister has laid out what he requires in terms of budget to start the recovery plan of the health service. So there's massive demands on budgets at the moment, and I think we just have to be realistic as well about the nurses deserve every penny that we can give them. I don't think there's anybody in this call that would deny them 12%. I think they're worth every penny of it. But we are in a real world, and we are dealing with really huge budgetary issues at the moment. So in terms of the proposal, I think we should be also writing to every executive minister, asking them to support that this money will be ring-fenced for the health service, and it may put us in a better position to renegotiate an increased offer to the nurses. But in the meantime, I don't think we should be stymieing them getting the 3%. Thank you.
Okay, and I don't actually think that we should be letting the British government or Treasury off the hook in that regard. A lot of this is as a result of years of austerity, but also we have to recognise we have a health and social care integrated system. So any Barnett consequential or any uplift in that, we will have to find additional resource, and that has to be recognised within the conversation as well. So that's a concern. So if Paula or Leah, and then we'll go back to Carol, have another indication from, and then we will want to move this on. So Paula, please. Oh, sorry, Jonathan. Yes, I had you in, Jonathan. Jonathan, yeah. And then Carol. Jonathan, yeah. Then or Leah, then Carol. Yeah.
Yeah, thank you, Chair. Look, I think everyone can agree with the general sentiment in relation to the support for nurses. Look, in relation to the specific proposal, I would have concerns surrounding some aspects of it as well. Could I suggest, and I know Carol has put forward a proposal, and as has Alan, could I propose, this is actually something I think we should give some consideration to. Would it be in order for us to revisit if members want to come back and obviously provide their amendments to the proposal or their new proposal, so that the committee can try to get a better grasp of where every other member is coming from in relation to some of their proposals. I'm conscious I don't want to make another proposal up on the hoof without giving it full consideration. So that would be a proposal from me, that we go away from this meeting today and we come back next week, and any party or member that wants to bring forward a proposal or amendment to this proposal, so that we can come to a collective decision on it and see where each other's coming from. That would be a proposal from me at this stage.
Okay, thank you. And then very brief, Arlia. Yeah, Arlia, please, and then I'll go briefly to Carol.
Yes, thank you, Chair. So yes, I take Jonathan's point, because we're all going to start making different amendments here. I don't think anyone is in disagreement with the essence of Jerry's motion is completely sound. I think the only part that some people might be concerned about is we're mentioning we're denying staff a pay. So I think maybe if the committee, if we can tweak it a wee bit, everyone's in support that the pay rise is required and it's needed. But just on the suggestion that Carol had made, I think that because I know the individual committee members will be engaging with unions, I know that we have, and I'm sure other parties as well. But I think the key thing is, as Carol had says, that Robin Swan, as the Minister for the Department of Health, is also carrying out that high level engagement with the unions. That needs to be taking place. But also it is important, I think, to call on the executive to do that lobby and that case with the British government. And I take Alan's point that the Minister was saying that it might be difficult to go back and to get more money off the British Treasury, but that's certainly not the way. We shouldn't be calling on the executive to do exactly that, because our health workers need it. So I would be supporting Carol's amendment, but I know that we'll obviously need to pull this together just so members are clear on what it is that we're going to submit or vote for.
Okay, and very briefly, Carol, then, and I'll go back to Jerry then.
Yeah, so I mean, the comment that Alan made, I think they need to be shared with the Minister and his officials, with the committee, Alan. And you're 100% right. I think all parties agreed we try and protect health as much as possible. But that also means, and I just want to put this out there, and I'm not doing it to be mischievous, we can't ring fence money to go to a private health sector at the expense of, at the point of need, free at the point of need for health and social care. We understand, everybody accepts and agrees that there's certain procedures that need to happen, particularly the red flag, cancer surgeries and things like that. So it's not the place we want to be, but we don't want people dying waiting. No one wants that. However, I would be certainly more open to Alan's proposal after we meet with the Minister and after the Minister has met with all the trade unions and that, because I think this is something that we all need to try and get into the same space. And it's not to be naive or Pollyanna about this, but that's what collective bargaining is about. And that, for me, is the preserve of trade unions and their representatives. I mean, on the other hand, there's been 2%, 3%. None of this has actually been made formally, and that's why I'm reluctant. None of this has been made formally. But I do understand what you're saying, that 3% for a consultant is much more than 3% of someone working in the canteen, working as an auxiliary nurse or working as a nurse on the ward. And perhaps the unison proposal that's floating around of £3,000 may be fair way, particularly given that many of them are paid workers in health and social care are women. So all that, I think we all need to hear collectively as a committee, rather than each of us going and doing different meetings and feeding that back. I think that's the fairest way. And Jerry, see, to be totally fair to yourself, so I want, when the Health Minister comes in along with officials after meeting the unions and representatives, to start getting into these proposals, because see, at the end of the day, in absence of that, it's going to give people, if they're minded to take a way out, which I don't think they should have. So that's the reason why I prefer either to pull this back until after those meetings, and then we can revisit this again. And that's, rather than just, having dissent at the committee, I think it will be the first thing for us all to do. But don't be taking us or me saying that as a way of not supporting what you're saying. I just think tactically we need to get everybody around the table, so when it comes to the crunch, no one can say they didn't have the information.
Jerry.
Thanks, Chair. Yeah, just a couple of quick points. You said yourself, Chair, about, and Carl, about blocking a pay raise. I mean, this is an effective pay cut. Inflation has gone up above 3%. So I think that point has to be made clear. It's not a good enough offer. I also met with Unison reps last week, who are absolutely resolutely opposed to the 3% and will be campaigning against it. And it's against pretty much every single union's stated position around pay and what's equitable. And I would make the obvious point: if you don't offer a fair pay increase now, towards the end, hopefully, of a pandemic, and when workers are being through so much, then when's it going to come? At what point in the future? And just also, I think Carl made a suggestion, or a comment, if I picked her up correctly, that the decision may not be final. I've got correspondence from the Minister to the Director of Health and Community at Derry City and Strabane Council, saying he's going to implement the 3%, so that seems pretty categorical there. And I think just in terms of the proposal, I mean, I proposed this last week, and in fairness, Chair, you suggested we discuss it in detail today, and thankfully we're doing that. I think it would be a shame if we put it back another week or another few weeks. And the proposal says that implores the executive to explore ways to fund a more substantial and fair pay uplift. To me, that means they're looking towards putting pressure on the British government and wherever else. If Carl has a proposal to put something specific at the end of the motion about the British government, I have no problem accepting that, but I think it has to be made clear that the executive will ultimately play a fundamental role within it. So unless the amendment takes cognizance of that, then I would propose that we have a vote on the motion as is. Thank you.
Okay, and while again I agree with much of that, Jerry, I still remain at core. I think it's wrong for this committee to urge them not to implement a pay rise to staff. I have every confidence in the ability of the unions and the Royal College of Nurses and Unison and those to represent themselves and to make their decision. For us to preempt that decision by calling for a pay rise not to be given to workers I feel would be the wrong thing to do. Pam, go ahead.
Yeah, Chair, thank you. I think nobody can argue that we all want nurses to be paid more, and believe they absolutely do deserve to be paid more, and declaring it as having family members in the profession. But I think we do need some more time on this to look at wording. So Jonathan did make a proposal as well that we would give this more consideration and come back on it. We want to get it right. Rather than simply just voting down or supporting a motion that we're not all, and we're obviously not all content with it as is. So I would suggest that we do give it that extra bit of time to try to come to agreement on the formal wording of the motion.
Sure.
Go ahead, Carol, very briefly, please.
So see the last paragraph, if that's removed, Jerry, and I'm just working on this, but if it's added, it's amended to also say that this committee calls on Minister Swan to engage with health unions in relation to a fair pay uplift for all health and social care staff, and calls on the executive to seek the increased funding necessary from the British government. So I think that takes into consideration all the points that everybody has raised. It also doesn't prevent the concerns that people have also raised when asking that the Minister engages with the trade unions and other staff site representatives and then comes back to the committee. So, I mean, effectively, we're actually trying to help the Minister be in a better position to get the increased pay that's needed.
Sure.
Who is indicating there?
Orlia?
Orlia, go ahead, Orlia.
Yeah, well, look, I think that, so I'm just conscious that Carl has made clear a suggested amendment, which I think would fall in line with what Jerry had just explained there whenever he was speaking. So if that's an additional line or two to add in to amend the Jerry's motion, then I think I would feel comfortable to obviously support that as it stands, if you want to put it to a vote.
Jerry, what's your thoughts on that?
Just to clarify, Carl, that was in addition to what's already, yeah?
No, Jerry, see the last paragraph? See, rather, because I believe I believe the amendment that I'm proposing would actually be stronger than your last paragraph, okay? So I would remove your last paragraph and insert the paragraph that I've just give.
Just read yours again, Carol, just for clarity, because we don't have that in front of us. Read yours again, please.
Okay, and that this committee calls on Minister Swan to engage with health unions in relation to a fair pay uplift for all health and social care staff, and further calls on the executive to seek the increased funding necessary from the British Treasury.
Okay, quickly, Paula, and then I think we'll have to go to a decision on this one way or the other. So go ahead, Paula.
Thank you, Chair. I think I would certainly feel comfortable with amending that last paragraph to include the engagement with trade unions, but I would prefer to leave it wider open in terms of exploring ways to fund it, because that would allow for engagement with the UK Treasury, but it would also then allow other more internal ways of looking at the sort of financial configurations around that. So I wouldn't go for Carol's full amendment, but just the inclusion of the trade unions part. Thank you.
Okay, thank you. Okay, members, so we have three proposals then. We have Jonathan's proposal to defer this matter. We have the amendment from Carol, and we have the proposal as presented from Jerry.
Sure, just to make clear what my proposal is, there's been some constructive conversation even in the course of this, but I would suggest that we, yes, defer to allow members to supply their amendments to the motion, and we revisit it next week with the intention of making a decision based on members' contributions and further thought about how they amend the motion to make it more impactful going forward. So that's one way. That's what I would be proposing.
Chair?
Yes, Paula?
Chair, my proposal is to amend what Carol has proposed. So there's actually four there, and I think that that's what Jonathan's setting, in that there's a lot of confusion now, and I think it'd be better if we all were allowed this extra week. I appreciate Jerry's point, but I think we have given it a fair hearing, and I think we should be allowed an extra week because it is a very, very important emotive issue. Thank you.
Thank you.
Okay, well, Jerry is entitled to put his question, but he's also entitled to look at whether that discussion has
Just a quick reply, Chair. I would have accepted Carl's amendment as an addendum, but so I don't accept it as an amendment. And I think we've taken a good bit of time today. We had a quick discussion last week, so I think we should have a vote on this proposal.
Okay. So yes, if the committee agrees to defer, then the question can't be put. So that will be a decision of the committee. So I take Jonathan's proposal first to defer. So what are members' views? Do the committee agree that we defer this for another week to allow further consideration?
Chair, I think that sounds good.
Yeah, I think so.
Just checking. So
Yeah, Alan as well.
Colin, Alan, Jonathan, Paula. Is Carol's hand up there?
Carol's hand up, yeah.
Yep. Orlia.
Orlia, was your hand up there? Yes. Second,
Yes,
Orlia.
yes.
Yeah.
Okay.
And Alan.
Yes.
Okay, so that's that.
So can I clarify what happens next?
what happens next is, as per Jonathan's, members will send in their proposed amendments to your proposal. We will put them all in the pack for next week, and then it will be a case of either coming up with an agreed proposal or just taking votes on each of them.
Okay. I mean, I think it's regrettable we couldn't vote on the motion today, but you know, I'm bound by the decision of the committee, obviously.
Okay, okay. Thank you, members. Okay. So, members, we are now moving in then to our Autism Amendment Bill, and I'll take just a very, very brief break there for about a couple of minutes till we get witnesses in that organ. We'll take a 5-minute break. We get witnesses into the room. Thank you. So we're now resuming then with our briefing from the bill sponsor on the Autism Amendment Bill. Members will recall that the Private Members Bill, the Autism Amendment Bill, was introduced in the Assembly on the 5th of July. The bill's sponsor is Pam Cameron, who will brief the committee today on the principles of the bill. I refer members to a copy of the bill and the EFM at tab 6 of your pack. Do members have any interest they wish to declare?
Oh, Chair, I should declare an interest as being the proposer of the bill and a member of the committee.
Yeah. And I'll declare my interest as having worked as a social worker with one of the trusts previously. I will. Any other interest, members? Just checking. No. Okay, thank you. So I would now then like to welcome officially in this context Pam Cameron, MLA Chairperson of the All-Party Group on Autism and the sponsor of this bill, Kerry Boyd, who is Chief Executive of Autism NI, Arlene Cassidy, who is a Special Advisor to Autism NI, and Kelly Maxwell, who is Director of Family Support with Autism NI. So Pam, please go ahead with your briefing.
Thank you, Chair. This all feels a bit odd, so forgive me if I blunder. And I'm glad to have colleagues from Autism NI here on board today. So we're going to have Dr. Cassidy is going to give a short presentation, and then I'll follow straight after with a longer presentation, and then we'll take questions, if that's okay, Chair?
Yep, thank you.
Thank you.
Okay. Thank you for having us. Right. My name is Arlene Cassidy. Having worked as a social worker in East Belfast during the Troubles in the 1970s, I moved to Barnardo's in 1980 to work with children with learning disabilities, and that's where my interest in autism began. In 1992, I was employed to develop Northern Ireland's first autism charity, PAPA, later renamed Autism NI. I retired as CEO in 2017, and I'm currently acting as an advisor to Autism NI and supporting of its role as Secretariat to the All-Party Group on Autism. My role today is to remind us all why we must resort to the Northern Ireland Assembly and legislative solutions for autism. Why are we here again for autism? So let me set some context. In short, we discovered autism late and never caught up in Northern Ireland. Until 1990, autism apparently didn't exist here. It was an autism-free zone. No diagnosis, no support, until Autism NI, PAPA, was set up by families and professionals. Yet services began in 1962 in England, 65 in the USA, 63 in Ireland. In the early 1990s, parents travelled to England for autism assessments, and autism was classified here wrongly as a learning disability. The first funding for statutory autism services was in 2002 to diagnosis only, and by then Autism NI had lobbied every board and trust, and autism strategies were agreed, then dropped as committed individuals moved on to other duties. The impact of all of this is still evident today, because even by then it was already too little too late. Waiting lists for autism assessment and diagnosis averaged between 2 to 4 years, with autism data then only available by a manual count. Research internationally reveals that the cost to society in human and monetary terms is greater through neglect than by actually doing something. The conclusions drawn from this dynamic crisis were that, firstly, there is something wrong. Firstly, there is systemic reluctance and failure across government institutions to recognise, understand, resource and plan for autism services, and that secondly, the Northern Ireland Assembly and legislative change was needed. An all-party group on autism was needed. The all-party group has its origins in the Autism NI nomination of cross-party MLA autism ambassadors back in 2001, and it was formally constituted in 2008 following a Northern Ireland Assembly delegation to Capitol Hill to meet with the Autism Caucus and agree a Memorandum of Understanding on Autism with the US Congress. That delegation was accompanied by the Celtic Nations Autism Partnership, which was an amalgam of the autism societies in Northern Ireland, Wales, Scotland and Republic of Ireland, committed to helping each other lobby each of their political institutions. The result of this political activism was the Autism Act, Northern Ireland 2011, as uniquely cross-party and innovative legislation, and the recognised catalyst was a parent-led Autism NI organised lobby seated in each constituency and with no professional lobbyists employed. That legislation was the first cross-departmental legislation here, predating the Children's Services Cooperation Act by 4 years. It introduced the annual publication of the first regional autism data collection. It remains the most comprehensive, lifelong, cross-departmental, single disability quality legislation globally. It amended the DDA to recognise autism. It mandated an ambitious recurrent 7-year cross-departmental national strategy for autism. This legislation held so much promise. Job done? Unfortunately not. Bringing us here, why we're here today. The APCA has gathered clear and shameful evidence that those charged a decade ago with the implementation of the Autism Act NI 2011 have failed us all. It is true that the DDA change has increased the recognition of autism and that the annual collection of prevalence data is progressing in its sophistication and potential. However, the failures around implementation are many and avoidable. I refer you to the Broken Promises report published in 2016 by Autism NI and National Autistic Society NI for the only independent commentary and evaluation of the Northern Ireland autism strategy for further detail. This report, which was launched by the APCA 5 years ago, remains relevant, but obviously does not take account of the continued deterioration in services as the gap between autism prevalence and resource investment increases annually. According to the Department of Health data, Northern Ireland has the highest prevalence rates of autism in the world and has proportionately, therefore, as a conclusion, the lowest investment in services. So what is going on? So we didn't have to be here, and it didn't have to be like this. So knowing what we know, why are we here and what must we do? We have to address the failures in implementation of legislation by setting down specific remedies. We have to address the failures in leadership and ownership and motivation, tackle duplication across departments and regional services, inject regional strategic consistency, address inequalities, address the continued legacy of investment neglect. And just how do we do this? By strengthening the Autism Act NI 2011 through the Autism Amendment Bill 2021. Thank you.
Okay, thank you.
Thank you, Arlene. So, as many of you know, and as the Chair has already mentioned, I'm the Chair of the All-Party Group on Autism and have been in this role since 2016. And I'm proud to be able to support the autism community within this capacity. I, along with colleagues within the group, believe that there is a huge gap in service provision that needs to be urgently addressed. Therefore, with the full support of the All-Party Group on Autism, I've sponsored a private members' bill called the Autism Amendment Bill, which will strengthen the current Autism Act of 2011. As Dr Cassidy has explained, when the Autism Act was introduced, it amended the Disability Discrimination Act to recognise and protect the rights of people with autism. It was the first legislation passed by this Assembly that mandates cross-departmental service planning and delivery across adult and children's services. As a result of the Autism Act, the implementation of the autism strategy is a legal requirement. However, we are all too aware this implementation has not happened in the speed or way in which it was intended. On numerous occasions, I have heard from various organisations, autistic people and their families that there is little to no support for someone with a new diagnosis of autism. Even getting a diagnosis is extremely difficult, with many families waiting up to 2 years and adults waiting up to 4 years. However, this is only the start of the autism journey, And as I will explain today, there are many, many improvements that need to be made in order to support this very vulnerable community. Over the past number of years, the All-Party Group on Autism has gathered evidence confirming the following points. Only one of the 3 action plans in the mandated NI Autism strategy from 2013 to 2020 has been completed. The annual Autism Prevalence report produced by the Department of Health now reflects that we have the highest confirmed autism prevalence rate in the world, with 1 in 22 school-aged children having a diagnosis of autism. The NI Autism Strategy progress reports are extremely subjective, generic and absent of any measurable outcomes or targets. No independent research or evaluation has been generated to assist discovery, planning or delivery. A well-publicised plan by the Health and Social Care Board to initiate an independent study to explore the different rates of diagnosis across the 5 Health and Social Care Trusts never happened. Assembly questions submitted by APCA members confirm that the causes for diagnostic inconsistencies across trusts remain unknown. And we do have a letter from the Health Minister acknowledging that his department does not know why there are such inconsistencies from trust to trust area. For example, why does it take up to 2 years for diagnosis in Belfast Trust, and yet the Southern Trust apparently takes 13 weeks? No government department has ever submitted any new bids for funding of autism services in the last 10 years. No new funding was attached to the Autism Act NI 2011 implementation. Indeed, the only published new recurrent funding injection was in 2016, when £2 million was allocated to health towards diagnosis only. The Department of Health maintains a medical rather than a social model of disability. This has created a serious funding imbalance for conditions such as autism, which require educational and social or community intervention. The Autism Act NI 2011 requirement for an autism awareness campaign has been replaced by an optional in-house intranet exercise and coffee mornings by Northern Ireland Civil Service, instead of the implementation of the initiatives recommended by the NI Autism Strategy's own Research Advisory Committee. The impact of all of this is best summarised by the reaction to the October 2020 public consultation of the Autism Amendment Bill. The public consultation received in excess of 1,800 responses, making it the highest response to draft legislation in Northern Ireland history. The high response rate is a huge indicator of the level of concern. 92% of respondents supported the need for an independent scrutiny mechanism, as they believe that the scrutiny, transparency and research in relation to autism services is currently inadequate. 95% of respondents supported a cross-departmental accredited autism training strategy, coordinated to target key staff and reduce costly duplication. 94% of respondents highlighted concerns and the need for consistent adult autism services. Similarly, support within the consultation was evident for both assessment and post-diagnostic services to be consistent across trusts. Significantly, there was overwhelming concern that the situation regarding support services had become worse. This obviously corresponds with the lack of investment in leadership, motivation and resources during a period of accelerating prevalence. Another important issue is the current financial cost to families. Private autism diagnosis clinics are on the rise as parents turn in desperation to find any service they can to access timely diagnosis and intervention. Many families cannot afford this route and are getting into debt to find answers and to get help. This is damning evidence of the failure of our health and social care sector, which should be free and timely at the point of need for all autistic individuals. Also, the fact that private diagnosis is even recognised by our health and social care trusts, whereas 10 years ago it wasn't, can only be interpreted as an admission of them not having the capacity to meet the need. It should also be noted that a private diagnosis at a private clinic often logically ties families into costly post-diagnostic early interventions. Meanwhile, the postcode lottery continues between our 5 health and social care trusts, with families reporting huge service inconsistencies depending on which trust you live in. All of these critical issues indicate that the Autism Act NI 2011 must be strengthened. The Autism Amendment Bill will build upon the 2011 Act by introducing measures to remove the existing barriers to full implementation of the law. Crucially, we need an independent scrutiny mechanism to drive forward future Northern Ireland autism strategies. This should be in the form of an Autism Reviewer. I now want to outline the reasoning behind the clauses of the bill at this stage. Within Clause 1, Autism Strategy, Consultations and Data, this seeks to ensure autism prevalence data is expanded to include prevalence data on adults as well as children. Currently, Department of Health data focuses on children only, but we also need to gather adult data to aid future planning and service provision for our autistic adult population. At the minute, we have no idea of the number of autistic adults we have, and therefore it's imperative that we develop our current data collection system further. Also, as other parts of the UK are counting adults only, the prevalence rates will be easier to comparatively analyse. At the minute, we are comparing apples and pears, as Northern Ireland's prevalence rates are based on children, whereas England's are based on adults. Moving on to Clause 2, additional components of the autism strategy. This describes the development of an autism training plan for staff across departments and public bodies. This will reduce duplication and increase consistency, coordination and competency across agencies. It will enhance workforce professional development and introduce a tiered strategy from basic awareness training for many to targeted accredited training for the few. Two of the most obvious examples would be training for all teaching staff in Northern Ireland, as well as mental health professionals working with autistic people. The next point within Clause 2 is to develop a regionally consistent early intervention service to ensure regional consistency of ethics and practice that feeds into the autism training strategy. We all know that early intervention works and is cost effective as it reduces later dependency on core services. There's also fantastic best practice models out there locally that need to be tapped into and delivered on a regional basis. Clause 2 further suggests development of a regional information service. As the prevalence rates have risen, so has the imminent need for information and support. A regional information service will ensure consistency of advice and will signpost autistic adults and families to local services within their area. It should be available through a number of different media types to accommodate different circumstances, for example, telephone, in person or virtually. Finally, Clause 2 also outlines the focus with which adult services must be developed, which combined with Clause 3 ensures regional consistency, meaning the development of a regionally consistent range of adult support services. The extension of data relating to adults will improve the capacity to map need. For example, as only 16% of autistic adults are in full-time employment, which is less than half of the total figure of the disability sector, we can all agree that this is an area that needs to be invested and developed further. Social opportunities are also needed, so many adults feel misunderstood, alone and unsupported. This is evidenced by the very stark fact that an autistic adult is 8 times more likely to complete suicide than a neurotypical adult, and I believe that the lack of support services and opportunities may be contributing to this terrible figure. Turning to Clause 3, the methodology of the autism strategy, along with the regional consistency. The autism strategy must have measurable targets and outcomes to measure effectiveness. This speaks for itself. Ultimately, any truly effective strategy must be measurable to assess success and what improvements and changes need to be made to achieve overall aims. The strategy should be a basis for ongoing transparency and accountability and will be an essential tool for the Autism Reviewer. Along with the general duty to consult introduced in Clause 1, Clause 3 includes a specific obligation to consult organisations when setting measurable targets. The autism strategy, therefore, must be developed in consultation with the autistic community. This, again, is self-evident. Nobody knows the needs of the autism community better than our autistic people and their families, as well as the voluntary and community sector that represent them. The 4th clause, annual autism funding reports, creates a new requirement of the Minister to lay before the Assembly a report from all departments, setting out how funding for autism has taken account of the NI autism strategy, the needs of the autistic individuals, the current prevalence rates, the potential for partnerships with autism rights bodies. This amendment will address the failure by all departments to bid for investment to progress the NI autism strategy previously. It will also evidence the matching of data against investment for example, is rising prevalence of autism being matched with rising investment. The final clause I want to highlight is Clause 5, the Autism Reviewer, which creates a requirement to set up an independent scrutiny mechanism, which will be known as an Autism Reviewer, who will have the following duties: to monitor the effectiveness of the NI strategy and to advise the Assembly, to assess the effectiveness of the funding arrangements in respect of autism, to review the adequacy and effectiveness of the law and practice relating to autism, to review the adequacy and effectiveness of services provided for autistic individuals and their families, to commission independent research, and to issue a report annually to the Department, which must then be laid before the Assembly. I propose an appointment of an Autism Reviewer with a budget allocation similar to that of the Mental Health Champion, but with duties that protect the independence of that post from departmental influence or interference. A budget for research is an essential component to guarantee service and cost effectiveness. These measures and the accountability that will be generated from the requirement placed upon the Department to submit an annual autism funding analysis to this Assembly will address proven concerns over the lack of objective scrutiny, accountability and motivation in the implementation of the autism legislation. So thank you for listening, and between us we are happy to take questions at this point.
Okay, thank you. A couple or a few from myself first, and then I will go to members for questions. And you had finished up there in relation to the reviewer. Pam, what process had you in mind for the department to appoint a reviewer?
Kerry, do you want to take that line? Or
well, we had, obviously Pam had thought about, we thought it would be on the same basis as the Mental Health Champion, and it's the main issue that we would have with any sort of reviewer would be that it has to be independent from the Department of Health. It has to be somebody completely independent that is there to review the strategy and to review whether the targets within that strategy, which again needs to be measurable and quantifiable, which they aren't at the minute, to ensure that they're done basically. And one of the big issues that also Pam said about was that the reviewer needs to have responsibility to be able to commission research as well, because there's a number of things that Pam highlighted throughout her speech there about the difference between the health trusts and the number of children being diagnosed in each trust and the diagnosis waiting times, and that we need to look into all of that, and also best practice with early intervention. But we think the Autism Reviewer needs to have that responsibility. But we're looking at a model similar to the Mental Health Champion, because it needs to be obviously cost effective, but it needs to be independent. This legislation that we currently have for 10 years, it should have been implemented properly. Only one out of 3 action plans were ever completed, and we feel that if there had been somebody independently scrutinising this and reviewing it, that wouldn't have happened. So that's the main issue with it. Do you?
That's it. It's really the Autism Reviewer. My understanding is that it's to be somebody to drive the legislation across departments, because the evidence that the all-party group has is that none of the government departments have made specific bids for autism in terms of their obligations under the implementation of the Northern Ireland Autism Strategy. So it's a driver, somebody who, as Kerry has said, someone who can produce evidence, and that can be presented and progress can be measured, rather than what we have at the moment, which is very subjective opinions and views of each government department.
Okay.
Yeah, just to add to that, I suppose we were very conscious in discussions and through the drafting process that we could have gone for some all singing, all dancing, expensive posts, such as a commissioner type role, and we were very conscious that we didn't want to take away from autism services or to place a kind of harsh financial burden on the system, which is already problematic at times. So I think that the reviewer was the preferred option through our discussions and through that drafting process, and we think that is something that could work. I suppose that in terms of the technical appointment process, I suppose that's we're really at the beginning of this discussion. This is really about, why we need to bring this legislation forward, and talking about the principles and aims, and really what the main aim of all of this is to look back at a really good piece of legislation that we have in the Autism Act, which is 10 years old, and look at why it hasn't worked, and then look at what can we do to fix that and make it effective and make it a really great piece of legislation, and that's what we're aiming to do through this bill.
And I think we're all very conscious of the huge burden that there is on families, and this issue about the postcode lottery has been discussed in the Assembly as well, and people paying for private assessments. Thankfully, the Department has agreed to start measuring that as a first step, but I think there's huge issues. And you'd mentioned cost there, Pam, and has there been an assessment of the overall costs that will be associated with the implementation of the bill?
We have RAISE are actually working on that piece of evidence for us, a piece of research, and it's not yet complete. I believe they are still waiting for some more detail coming back from the Department of Health. So we were hoping that we would have it for this session, indeed for the debate next week. We're not sure whether that will be there, but the aim is to keep the costs as low as possible while maintaining that independence from the department to ensure that the role can be as effective as possible.
Okay, thank you. And the final one for me then just is how the bill will ensure that the outcomes and the impact are measured and achieved that you're seeking to achieve. How will those be measured?
Well, they're obviously from the bill, as Pam has said, the strategy is a legal requirement, and any strategy then, I know we have an interim strategy at the minute, and they're also consulting on a new autism strategy too. But it really will be, as this reviewer is part of this new amendment, part of the bill, they will be overseeing that any autism strategy in Northern Ireland is going to have targets attached to it, measurable targets, because if we can't measure what's happening, we don't know what's happening, then how can we plan for the future? We don't know how many. We're looking at statistics here from Autistica, which is a research charity in the UK in London. And basically they're saying 16%, well, National Autistic Society as well, said that 16% of adults with autism are in part-time employment, 22% in any type of employment. We're using statistics from over the water, basically, to try and help us plan here. We need to know here what exactly is happening, how many adults here are in employment. We also need to be counting adults as well. We only count children in Northern Ireland. We were able to say 1 in 22 children are coming through. England, to be fair, don't count children, so they're going on the adult prevalence rates over there, 1 in 100. But we do need to be able to plan, and the only way to do that is through obviously counting how many adults that are coming through. And any sort of strategy has to have targets attached to it. We can't just say things like we're going to improve social opportunities for adults. How are you going to do that? We're going to improve employment opportunities. How are you going to do that? How many adults with autism do you want to see in employment in 5 years' time? That's the type of thing I'm thinking about. Are we going to be training up frontline staff who's working in employment opportunities, or employers to be able to support an adult with autism in the workplace? I want to see proper measurable targets set out, and that's what the reviewer will be doing, and that's what will be attached to this new bill as part of the strategy.
Yeah.
I think the two points I'd like to make are the importance, as really the point has been made by the bill sponsor and by Kerry, and that's about independence. The crucial thing is the independence of this reviewer, and also the cross-departmental duties of that. Those are the two things that set it apart and that would strengthen the original legislation. So really, I think as we move forward, I think those are core elements to make this piece of legislation effective, so that we're not coming back again.
Thank you. So I'm going then to Paula, then Cara, and then Jonathan at this point, are the indications I have, and Jerry then. So Paula, go ahead, please.
Thank you, Chair, and thank you, Pam, for bringing this forward. I suppose we're all getting a lot of emails continuously from parents who are very frustrated with the lack of services and the delay, so it's very timely. I am wondering, however, how this would sit alongside the consultation on the strategy, as Ketlich has just outlined there, and whether some of what is in your bill could actually be proposed in a strategy format as opposed to a legislative one? And the second question is in relation to workforce and how the proposals will actually impact on an already a workforce that already has a lot of vacancies and gaps, and whether you have engaged with the relevant trade unions and representative bodies around how those gaps could be filled very quickly if this bill is taken forward. Thank you.
Apologies, Paula. I'm struggling really badly to make you out. It's not very clear at all.
There's a wee bit of echo. If you just repeat that, Paula, please. There is a wee bit of echo.
Or you give us a short version of it. Be fine.
I will. Okay. Short version is, first of all, why the strategy that the Department of Health is bringing forward, why some of the proposals in your bill cannot be put forward in a strategy format. And secondly, how you are identifying how workforce gaps in terms of assessment, for example, will be filled in the short term to actually meet the needs of this piece of legislation.
Okay, well, I think on the workforce element of it, Paula, I suppose that would be a problem for the Department of Health to be kind of brutal about it. I mean, I think we know that intervention and help and diagnosis and all the good practices out there in relation to autism can help everybody and help us all to live fuller and quality lives. So I suppose it probably comes back again to the fact that we're not actually counting and we're not gathering that evidence we need to see what is actually required out there. And I think until you have that absolute baseline of what is needed in Northern Ireland, it's going to be very difficult to assess what the impact is going to be on workforce. So I think that would be my point. I don't know if Kerry has anything, or Kerry, do you want to answer that first point?
Yes, I was going to about the proposals within the why can they not be inputted into a new strategy, so to speak. Yes, they can, and obviously, we will be responding to the Department of Health and about that. But the whole point is, we did have the original strategy, although it still didn't have targets attached to it. It has to have targets attached to it, measurable targets. Somebody needs to implement it, Paula, and it hasn't been implemented. This legislation has taken 10 years, still things aren't implemented. Whenever you're looking at 1 out of 3 action plans being implemented over 10 years, somebody needs to take the reins and take control of it, and I see that as an independent person to do that, to review the strategy and to make sure that those departments are working together cross-departmentally, and also to ensure that they're bidding for funding. Whenever you see the prevalence rates quadrupling in 5 years, they need to be looking at what 5 years ago we were looking at 1 in 50, we're now looking at 1 in 22 school-age children. Has any department asked for extra funding to be able to support that? No, they haven't. We know that the referral system for diagnosis was created to deal with 1,500 referrals a year. It's now looking at 4,500, so it's not fit for purpose. And we need somebody to take control of this and take the reins and to look at this as a whole, what is happening with the autism community and what their needs are. And I feel that's the difference. Yes, all these proposals can go into a strategy, but if nobody's going to take it forward and take ownership, then we're back to square one. That's my opinion.
If I could.
Yeah, go ahead. Arlene was coming in there. Paula, sorry. Go ahead, Arlene.
It was just to follow on the point that Kerry has made from the Secretariat of the All-Party Group on Autism's point of view. The All-Party Group has written at least twice, I would say reliably, to the Department of Health, asking them to engage with the bill sponsor and with the All-Party Group on the formation and the draft, and the pro forma was sent to them for comment, and none was forthcoming. An invitation was sent also to the Department of Health to attend some of the all-party group meetings, and that invitation was taken up, but then with the COVID situation that terminated. But so the Secretariat, the All-Party Group on Autism, has tried to engage Paula on this so that we could go forward in a joined up way, but the Department of Health have basically declined.
Okay, no, appreciate that feedback. Can I maybe just go back to the workforce issue, because I don't think that Pam I understand what she said, but the purpose of my question was more around how she and the supporters of the bill in the room there have actually engaged with the representative groups in terms of workforce, the relevant allied health professional representative groups, in terms of how the workforce could be ramped up to meet the needs that come out of this piece of work.
I suppose at this stage, Paula, we're looking at the aims and principles of the bill. We're not, at that detail as yet, and I would imagine there will be a lot more activity around it should the bill pass the next stage. So I think that would be it is a very good point, and I think that's something going forward. I don't think we had any responses in terms of the consultation process.
No, it was as Pam said, it was the highest consultation response in Northern Ireland history. So 1,800 people and organisations responded to it. Whether they did or not, we don't know. I'm not sure. But yes, it will be something that I'm sure you'll be looking into after this. But it's just trying to get there's lots of different parts to this bill. There's lots of different things that haven't been done. This is one of the very important ones. So yes, it will be something that you'll be looking into, I'm sure, the next stage.
Yes.
Thank you.
No, that's absolutely fair. It's a genuine question, so but thank you very much for your work to date.
Thanks, Paula.
Thank you, Paula. I'm going then to Cara. Cara Hunter, go ahead. Cara Littlehull.
Thank you, Chair, and I'd like to thank the panel and Pam for being here this morning, and just thank you, Pam, for bringing this important bill forward as well. And I've noted in my time with an MLA that many individuals who are later diagnosed in life as adults with autism have said they've really struggled to find that support and for their families to find support. So I'd like to thank you for raising that important point. And it is sad to hear of the historical challenges and the elements of systemic discrimination that people with autism continue to have to endure. Can I ask a question just around, you had discussed there basic awareness training for those like mental health professionals. Can I ask, would this include working with first responders such as paramedics and police? And also just another question, you touched on the importance of a cross-departmental approach and the role of the Department for Education. So I'm just curious in what ways you feel our curriculum could change to ensure that we assist in creating a fair and inclusive society for those living with autism. Thank you.
Thank you, Cara. I suppose in relation to the paramedics and police and training, I think that's exactly the type of thing that you would really want to see. And talking about teacher training and mental health professionals, it's just an example, the tip of the iceberg. I think certainly autism training at a very basic level is only going to be good for everyone, and that's one of the reasons why we had the debate around the call for mandatory training for teachers and classroom assistants in the past, because we recognise that this type of training is good for everyone. It's not that you single out autistic children in that instance. It's that you change how you deliver as a teacher, whatever, to be all-encompassing and recognising that there are autistic individuals in front of you, and I think that's good for everyone. So I think it would be an aspiration to see that kind of basic training rolled out to all those types of organisations who are dealing with people on the ground day and daily. I think it's just good for everyone to have that awareness. Sorry, what was your second question, Cara?
It was just around curiosity around looking at the Department of Education and our curriculum and what more we can do, with young people, with our pupils, with our students, to be more autism aware and to contribute to a more inclusive kind of society.
Yeah, and I think actually that leads back to my previous answer there. The call that we had which was supported across the Assembly by all the parties, for the mandatory autism training of teachers and classroom assistants. I think that is really is something we should aspire to get to, and I know there have been improvements in that direction, but I think we can do more across society. So I don't think it was seen, Kerry might want to mention more about it, I don't think it was seen to be something that would be a huge burden on the curriculum by any stretch of the imagination. I think it's just a matter of kind of catch up in terms of that training. Obviously, teacher training colleges, you'd want to see it included there, and then you would want rolling training as you have with all sorts of topics within that profession. I don't think we would envisage any great burden on the curriculum at all. In fact, if anything, it should make things easier. If you want to comment on that, Kerry?
No, just obviously Autism and I led the campaign a couple of years ago for mandatory teacher training, and we thought by now it would have been implemented, but it hasn't. And we find, you know, it's exactly what you're saying, Cara. It's obviously about helping a teacher support a child with autism to, you know, to provide their best educational opportunities and outcomes that child could possibly have. But it's also, I think, you know, a lot of teachers don't understand autism. There's a lot that do, but there's still some that don't. And it's about being able to support that child within the school environment, but also I think it'll bring about a culture change within the school where other children will understand autism better if their teacher understands it better. They're not saying that child's being badly behaved and they're having to put them on reduced timetables, and kids are on, you know, saying, oh, that child's being put out of the class again or having to go home or blah, blah, blah. You know, it's about a full culture change, and I think it's bigger than just teaching staff training. I think it will, you know, children are our future, and they're in a class with other kids with autism. They need to understand it too, and I think it starts with a teacher, and I think that's why it's a bigger issue than just training up teachers.
I completely agree. Thank you.
Yeah, briefly, Arlene, go ahead.
Just very, very, very quickly, Cara, you mentioned first responders, and there was Pam referred in her presentation to models of best practice that already exist in Northern Ireland, and it could be tapped into and brought together and utilised, especially if there was an Autism Reviewer to capture all of that information. And so there was a partnership, and often there are the best outcomes that are mentioned in the autism strategy and the progress reports produced by the autism strategy are often those when government departments did work hand in glove with the autism advocacy sector. And actually, there was a project with the Department of Justice targeted at first responders and setting in information that was to red flag individuals with autism in emergency situations. And the legacy of that project was a training for trainers. But again, unless there's a strategic oversight with someone like the Autism Reviewer, that sometimes is lost as staff move on. And it's not captured in research potentially and brought forward.
Okay, thank you. Going then to Jonathan. Go ahead, Jonathan, please.
Thank you, and can I thank Pam and indeed those presenting for coming to the committee today on this very important topic. Could I start off by asking, how will the provisions of the bill make autism services more person-centred? And given the conversation that has just been had in relation to autism training in schools, which I think is definitely a requirement, can you outline what conversations has been had with universities, in particular our teacher training universities, that can help better inform teachers as they progress towards the classroom, and so that you're essentially tackling the lack of information, the lack of training in relation to autism at a very early stage?
Thank you, Jonathan. I suppose I'll maybe refer to Kerry for the second point around universities. I don't know what conversations there have been with universities, but I'll let Kerry speak to you about that in a second. But in terms of making this more person-centred, it's really it's integral to understanding autism that not two people with autism are the same. I think that's really important to recognise. Each individual is uniquely impacted, and any attempt to provide information or services to autistic people and their loved ones must consider their individual needs. I think that's really important. In fact, within Clause 3, which deals with the methodology of the autism strategy, it explicitly states the strategy must take into account that persons with autism and their families and carers have individualised needs. I think that is it is really vital to realise that. And the bill further outlines how training should be provided to staff of NI departments and other public bodies to ensure that staff have an understanding of autism and are able to adapt their practice to ensure they're working in an autism-friendly and a person-centred way. So I hope that answers that for you, Jonathan, and I'll see if Kerry has anything more on the university question.
I was going to say also about the person-centred part of that as well, and I think the likes of the new addition to this amendment bill on the information service that will be available for adults with autism. Autism Now obviously has a helpline there, and we were getting more and more of the past number of years adults calling through wanting different information on supported housing, employment, things like that, social opportunities and that. But that really will be the link to the person-centred approach, where they're able to find out exactly what that person needs and be able to support them in that way. And also obviously the Autism Reviewers role would be to work with autistic people themselves, as well as the various voluntary organisations, as well as ensuring that the department is leading on strategy and completing the strategy basically, and the action plans attached to it. The whole way through this, it needs to be person-centred. The adults with autism and their families need to have input into this strategy, and I know that's what the department's doing at the minute. However, our issue would be whether it's actually completed or done. Sorry, and then the second part about the universities. Yes, I know that some of the universities already have initial teacher training. Kelly, can you?
Yeah, the all-party group in autism was lucky to have Ulster Teachers Union along, who presented on their concerns around teacher training, members saying they wanted it, parents and carers were saying they wanted it, autistic individuals felt it was needed, but there were concerns that there wasn't consistent training, certainly within the universities. And with statistics that are 1 in 22 autistic children in Northern Ireland, every teacher is going to have an autistic child, if not more than one, in their classroom. And we need to equip them so they can equip children to reach their full potential. That absolutely will mean, as autistic adults, they can contribute fully to society, and absolutely mean that we should have enhanced not just awareness but supports and reasonable adjustments within workplaces.
Okay, thank you.
Sorry, just another 2 questions.
Very briefly, Jonathan, please.
Yeah, in relation, obviously the huge backlogs are issues in which has really essentially driven the public debate on the lack and need for an autism bill that you're bringing forward. You'd mentioned statistics surrounding the Southern Trust in terms of their capability of delivering an assessment compared to others. Was there any conclusions as to why there was that disparity? Like, for example, was there things that was being done well elsewhere that could be applied regionally? And secondly, what are the main deficiencies in the collection of data that the bill aims to address?
Thanks, Jonathan. I suppose, as I had already mentioned, we did actually have clarification in the letter from the Health Minister that they basically didn't understand why there were those inconsistencies across the trust. So we don't have an answer to that. I mean, I presume the likes of Autism and I may have theories behind that, but we certainly don't have any official answer to that. And in terms of the data collection, the data is collected very, very differently. I've been listening to Kerry and Arlene talking about this for many years, that we're just not. It is apples and pears. We're not comparing like with like. So it's very difficult to plan services or to workforce plan, given that you don't have the information in front of you that you need. We need to start from a base. So I think it's important that is addressed, and that's why this legislation aims to ensure that we do actually get the data that we need in order to know what we need to do with that data, and how in order to inform us on how we need to support autistic individuals within Northern Ireland.
Okay. Yep, okay, thank you. And going then to Jerry, and then back on the remote to Orlia after Jerry. Go ahead,
Thanks,
Jerry.
Pam. Thanks, panel. Just a couple of questions. I'll go through them quickly. So in regards to the autism strategy, what sort of engagement has been happening already, or do you perceive to be happening going forward with education? Specifically, I was looking at some figures there. I think 14% of people in school with autism have no SEN and I don't know the figure for inadequate support, but obviously I'm presuming that's quite high as well. And there's obviously a lot of concern about the use of restraint and seclusion mechanisms in school. So has there been any consideration of those points, and then just what is the sort of expected or hoped education engagement with the Department of Education?
Do you want to take that?
Do you want to speak about seclusion and restraint?
Yeah.
What's been happening? We obviously take over 6,000 phone calls a year. We've got 22 support groups throughout Northern Ireland, and we hear every day about things, those issues that you're talking about. And Kelly's the Director of Family Support. So,
Kelly, before you start, could you just come as close to that microphone? I'm just conscious that people online might be, we're hearing you fine in the room, but online it might be a little bit more difficult.
Okay. Yes, Jerry, you're absolutely correct. 86% of autistic children have special educational needs within Northern Ireland, and that's from stages 1 to 5 on the Code of Practice. Certainly, restraint and seclusion has been brought forward through the Autism ANI helpline and through our support groups. So we have, as Kerry mentioned, over 20 support groups that deliver over 240 support group meetings per year. And the themes that come through, because those issues don't just affect autistic children, they affect whole families in terms of stress and lack of access to supports. And the APGA have engaged with the Department for Education and also the Education Committee to raise concerns. And I might pass back to Arlene or Pam to progress that in terms of the responses that come in.
Yeah. Well, I know that Autism NI have presented to the Education Committee as well as the Health Committee. In terms of the APGA engagement with the Department of Education, it obviously has been through correspondence, so they have not been excluded. But I don't really have any information for you to enlighten the topic.
We did. There was a letter went out about restraint and seclusion well over a year ago. We highlighted about must have been the policy or something, the data policy. This just what you're asking now just highlights the amount of work that goes in. There's literally hundreds of letters that go out, every year from the all-party group that Autism Now provide the secretariat for, and we can sit here all day. And that's why we need this sorted. That's why there needs to be an Autism Reviewer in. We're a charity doing this. But yes, there has been back and forth over the past number of years. There's been debates happened. We've presented to the Education Committee about the same issues that you're saying. And nothing really has changed, in my opinion. The mandatory teacher training still hasn't been implemented. It doesn't look as if it will. And this is why we feel that the only way out of this is now to amend the original Act to strengthen it, to ensure this does happen and to ensure that somebody can take the lead. Autism and I do an awful lot of work, supporting the all-party group and, writing all these, presenting and that, but we're here to run a charity as well, so there's only so much we can do, and that's why we feel that this is the only way to do this is through somebody taking the lead on this, and it can't be the Department of Health because it hasn't happened in the past 10 years.
Arlene?
Yeah, just yes, memory has twigged. Basically, I think the best response is to look at the progress reports that have come from the Department of Health, and you look at what the departments say that they have done, and they don't need this legislation because they're doing everything perfectly fine. So that's the official response that we would get from the Department of Health, the Department of Education, and not to take away from the tremendous work that is being done. And, very, very, very committed professionals that are working there, but it's just again, it goes back to the point. It's the ownership, it's the leadership, it's the drive, it's the motivation to implement the legislation as services are drowning under the need.
Okay, thank you.
Sorry, can I just make an amendment there? The all-party group didn't send a letter about restraint. There was people part of the all-party group that were taken forward as part of the Education Committee, if I remember correctly.
Yes.
Miss Little on that, okay. So that's what happened. Yeah.
Just one final point, quickly. Thanks for your answer. Just the diagnosis. I think Pam or Arlene touched upon the kind of disparity in terms of support services and diagnosis of autism on the postcode lottery. I think that's obviously quite major, and You know, I know that the bill obviously has no significant financial strings attached to it, but presumably there'll be the need for more assessments, more support services. So has there been any sort of, if not in the bill, consideration around that? And then just maybe a comment, if anybody wants to. A figure from BBC said that in the 10 most deprived areas, autism is 37% higher than the northern average. So in terms of resources and services needed, what's required, even though the bill can't have it all in it, has there been any consideration of that? Thanks, that's me.
Well, before I come to Kerry, I would say that I think these type of questions, this is what is driving this bill, because we don't have the information that we need, and departments and government cannot plan to meet a need when they don't know what that need is, and that's very apparent. And in the 3 years when the Assembly was down, the all-party group met very regularly and had incredibly long meetings and great attendance from all the parties and great participation, and we really took that opportunity to kind of to drill down more and question departments into what actions they'd taken and what information they had and what came back. What I absolutely remember is that almost every response was like a copy and paste of an initial response. So it's very clear that I think the departments should actually welcome this kind of addition in terms of legislation to allow them to focus on gathering the really vital data that's required in order to meet the needs. I mean, we all know as elected representatives, autistic individuals and families and charities who do great work on assisting and helping people work their way through their lives with autism. But I think until we have that very basic level of data, we can't plan, and we can't spend, and we can't make differences, and we can't make changes, and we can't improve or help people to live out their lives to the fullest if we don't have that very basic information. So I think, in terms of education, if a teacher was marking the original Autism Act, I think to put a comment down to say could do better would be going very lightly on them in terms of performance. So I think what we want to see is a good piece of legislation that was brought in 10 years ago. We want to see it working. We want to see it enacted and being implemented in its fullness.
Just to add to what Pam was saying, we wouldn't have the figures that you have quoted regarding deprivation area if it hadn't have been for the original Autism Act. It seems to be that we have to spell things out to make them happen, and the data wasn't being collected. As I say, it was a manual count by clinicians at one stage. So, the Autism Act brought forward a responsibility to publish an annual report. And to the credit of the people who are publishing that annual report, they've now become increasingly analytical about the information, but they need the cooperation of the Health and Social Care Trust. So there's still a great reliance on the school census figures. So there's still cooperation needed, and that's part of what this amendment is to strengthen what has already been started, and as Pam said earlier, to include adults in that data as well.
Thank you. And finally then, Orlia Flynn. Go ahead, Orlia, please.
Column, and thanks very much to Pam and the team for briefing us today on what is a really important bill. In my opinion, we all, I'm sure, have family, friends, relatives, constituents who are all dealing with these issues and who have a diagnosis of all the different levels of autism. Just to follow on from Jerry, a couple of Jerry's points that he made actually, I think the issue around and I understand, Pam, what you're saying as well around when you haven't got the needs analysis done, you don't know what the need is, and it's very hard to sort of set targets and to know what sort of specific interventions that you need to make, because we're having the same issues in terms of, as you will know, with the mental health and what data will hold on that and the levels of suicide. But I think it is important to recognise that if that information is there around that the levels of autism is higher in areas of deprivation. I'm just wondering, is there any specific, or can there be any specific mention or sort of recognition within the bill around dealing with that, you know, the health inequalities, the deprivation, and how this bill can try and help, you know, do some more sort of targeted interventions in those areas. And I know that might be something then that that the Autism Reviewer, if that comes into place, that might be a role that that person or that individual can take up. But I just think it's a really important point to make. And also, Jerry had asked around the engagement that you have held with other groups, and I would just be interested to know around what engagement or sort of feedback were you getting from some of the grassroots organisations that are dealing with these issues. Because I appreciate that the bigger charities are doing great work, but there's also a lot of on the ground grassroots communities that are working very, very closely with families who are struggling day and daily, who have relatives that are dealing with autism. So just if there's any feedback on that, if you have picked up any of the localised knowledge from the local groups. And then on the early intervention service in clause 2, I know that, Pam, you had mentioned there's some best practice models that are already out there, and I'm just wondering, has the department, are you aware if the department has already done any work to initiate an early intervention service, or is that still, like, you know, is that factoring into the autism strategy anywhere, or has none of those initiatives been lifted by the department as yet? And then just finally on the reporting on the funding, I know that you have the funding reports in clause 4, and just one of the speakers had mentioned earlier that there's been progress reports that have been done on the autism strategy, and I'm just wondering at the minute, are those progress reports, do they include any reporting on the funding, or have you not got any of that information at the moment? And is that why obviously then you're aiming to get the to put it into legislation that you have those annual funding reports? Thank you.
Thanks, Orlea. Thank you for your comments there. You're asking lots of really relevant questions, and I think what I would say to you is we're just at the beginning of this. We need you to vote this through the next part of the process next week, if you would, and let us look at all of those issues. I think once you're gathering that data, then it'll become apparent what the issues are, and I would imagine that would be an issue for areas of deprivation, and so those inequalities would need to be addressed. But again, until we have something on paper, something in front of us to actually show what the need is, how do you address that? How do you begin to look at that? I'll pass over to Autism NI in terms of, I think most of your questioning is around grassroots and that local knowledge. So obviously, you know, it's the third sector, it's charities like NI, Autism NI that do such great work, and really they are the ones who are dealing with us day and daily and hearing the variety of queries and concerns and the needs that are out there. So I'm going to pass you over.
Yeah, and the other thing I just want to say is you're asking about you know, the areas of deprivation, and yes, they are highlighted within the last Department of Health report. And again, that is something we need to know why there's twice as many, or whatever, the 37% higher in areas of deprivation than other areas of Northern Ireland, and why certain areas, rural versus city areas, why there's a massive difference there as well. And it's something that's why research is going to be so important with this as well. We need to know why this is. They can't just, you know, you can't have 3 times more diagnosis happening in Belfast and the Southern Trust per head. You know, these are the type of questions we have asked the Minister, Minister for Health, and who has said he doesn't know. So we do need, and this is another important reason why this reviewer needs to come in, needs to look at the research, needs to know why this is happening in these various areas. And you also mentioned early intervention. There's lots of good models of early intervention out there. Autism Now has a fantastic model of early intervention, but each trust area is doing it differently, and they commission services differently in each area. And you know, some areas may get a more comprehensive early intervention service than others, and that's why the parents talk about a postcode lottery. Similarly, some families are waiting up to 2 years to get a diagnosis, whereas other areas they're only waiting up to 13 weeks. So all of these differences between the areas need to be brought together. We need to have some sort of uniform regional early intervention service that is tailored to each family, that comes in straight after diagnosis, and that diagnosis can't be waiting up to 2 years. And then some, I heard this morning that there's a family waiting up to 4 years in one of the trust areas. So this can't be happening any longer. Early intervention has to happen straight away, straight after diagnosis. But there is good best practice models out there. It's just getting the trust to work together. Somebody needs to come in and help them join all of this up and look at that research and look to see why certain areas have a higher prevalence than others and what needs to be done in those areas. And then the other question about grassroots organisations, obviously we're one ourselves. We work on the ground. We've got 22 support groups throughout Northern Ireland. We've been here for 30 years. We work with the likes of the National Autistic Society, Autism Initiatives. We also work with the smaller groups on the ground, and Kelly will be able to tell you some of the groups there.
Yeah, we work across voluntary, community and statutory supports. We know that no one organisation can do everything. We provide menus of options that include partners from those organisations, and in actual fact it's very clear that a multimodal approach absolutely is generating conversations around increased needs for autism families before, during and after diagnosis. In actual fact, those needs have heightened since the pandemic, and I know that in terms of family support hubs, which we are a member of across Northern Ireland, some have actually written to locality planning groups to raise the needs of autism families in their area and the need for supports from statutory organisations as well. So it is something also that our helpline takes in, because the helpline is there for autistic individuals, parents and carers and professionals, and we daily have professionals ringing for supports for families that also include our MLAs.
Okay, thank you. Thank you, Pam, for bringing this forward and for taking questions from the members. Thank you, Kerry, Arlene and Kelly, also for appearing in front of committee today and for your assistance in our consideration of this matter. And I want to wish you all the very best in the time ahead, and look forward to working our way through our full committee scrutiny of this bill. Thank you.
Thank you.
Okay, members, I'm going to propose we take a short break here, just a 5-minute break to get the officials on the line for the next session. Members, so we're now resuming with agenda items 7 through to 28. These are a series of statutory rules. So we have a number of rules which we deferred from last week. Agenda items 7 to 17 are SRs relating to coronavirus restrictions. A copy of each SR and the accompanying notes are tab 7 to 17 of the pack. Can I refer members in particular to the Clerk's memo at tab 7.1, which is a summary of those 11 SRs. Departmental officials are here to brief the committee on the content of the SRs, so I'd now like to welcome by video link firstly Mr Nigel McMahon, and Nigel is Chief Environmental Health Officer. Nigel, are you able to hear us there okay?
Chair, yes, thank you.
Okay, and we're also being joined by Marianne McKeever, who works within the Health Protection Branch. Marianne, are you able to hear us okay?
Yes, I can, Chair, thank you.
Thank you very much. So we're hearing both of you clearly, but Nigel, your video feed is very disrupted. I don't know what it's like, pixelated or something, but anyway, we can hear you, so I would go back to you, Nigel, and think you could carry on with your briefing based on the audio, and if you can do anything with the camera, then that'll be a bonus. Thank you.
Okay, Chair, apologies for that. Good morning, Chair and members, and thanks to the committee for inviting us today to brief on quite a number of sets of regulations that are changes to the restriction regulations that have been made primarily over the summer. If the Chair and members are content, the way we'd like to do this is to focus first of all on the changes to the main restriction regulations, and then talk about the subsequent changes that have been made to the face covering regulations. I think that's probably easier then to follow the flow of the changes that have happened over the summer. So if the Chair is content with that, I'll pass over to Marion, who's going to provide the main briefing to members this morning.
Okay, yes, content with that, Nigel, and maybe that'll give you a wee opportunity then to see if there's anything can be done with your camera. But I'll go to Marion then. So Marion, Leanna, thank you. Go ahead.
Okay, thank you, Chair. So today the committee is considering 11 statutory rules which were introduced following decisions of the Executive taken between the 1st of July and the 6th of September. As Nigel's mentioned, due to the summer recess, we have a larger than usual number of amendments to consider today, and I will try to summarise the changes as briefly as I can. In regards to the restriction regulations, amendment numbers 8 to 15 have been made to the Health Protection Coronavirus Restriction Regulations Northern Ireland 2021, and I shall also detail the 3rd, 4th and 5th amendments to the Health Protection Coronavirus Wearing of Face Coverings Regulations Northern Ireland 2021. The committee will be aware that at the executive meeting on the 1st of July, some changes were agreed that had been deferred from the 21st of June due to rising cases of the Delta variant. These were implemented by Amendments 8 and 9 to the regulations. The executive decided that from the 2nd of July, the cap on outdoor gatherings would be removed, with the maximum number permitted to be determined by the risk assessment carried out by the organiser or operator of the gathering. This change was introduced by Statutory Rule 2021 number 197, Amendment number 8. The remaining changes from that executive decision on the 1st of July were introduced by Statutory Rule 2021 number 199, Amendment number 9. Therefore, from the 5th of July, all types of gatherings outside of those at domestic settings were subject to a risk assessment if they have more than 15 participants for indoors or more than 30 participants for outdoor gatherings. Live music was permitted indoors and outdoors in licensed and unlicensed hospitality businesses at ambient level only. Music was permitted at outdoor music events with no restriction on volume, and social distancing requirements were removed for these outdoor events. And the number of households permitted to meet outdoors at private dwellings was increased from 3 to 5, with the maximum number of people remaining at 15, not including children aged 12 and under. Statutory Rule 2021 number 201, Amendment number 10, made on the 7th of July, provided that an organiser of an outdoor event for which there is an occasional liquor licence must require audience members to purchase a ticket in advance and must obtain visitor information. At its meeting of the 22nd of July, the Executive considered the ratification of further relaxations on its pathway out of restrictions and decided that from the 26th of July, at outdoor domestic settings, a maximum number of 15 people from an unlimited number of households would be permitted to gather, excluding children in the total, and close contact services would no longer be required to operate an appointment-only system. These changes were introduced by Statutory Rule 2021 number 217, Amendment number 11. The Executive met again on the 26th of July and considered whether further relaxations could be made given the data presented at the time. At that meeting, it was agreed that theatres and concert halls could reopen, and the number permitted to gather indoors at a private dwelling was increased to 10 persons from 3 households, or 15 persons from 3 households if one household consists of 10 or more people. These changes were introduced by Statutory Rule 2021 number 220, Amendment number 12. Following the relaxations agreed at the Executive meeting on the 29th of July, Statutory Rule 2021 number 224, Amendment number 13, came into operation on the 30th of July. This permitted music at other indoor venues in addition to theatres and concert halls, and reduced the required social distancing to 1 metre in all relevant places. At its meeting of the 12th of August 2021, the Executive agreed to move on some additional relaxations taking effect from the 16th of August, and this decision was implemented by Statutory Rule 2021 number 233, Amendment number 14. This amendment removed the cap on the numbers allowed at outdoor domestic settings and removed the restriction on outdoor raves. It removed the provision for bubbles or linked households, as this was no longer required. The amendment removed the limit of numbers permitted at tables in hospitality venues, and it reopened conference centres, enabling conferences and exhibitions to resume with some mitigations. This included the collection of visitor information, the provision of allocated seating for visitors to the venue unless attending an exhibition, and a restriction on visitors' movement within the premises, except to enter or exit the premises, access a seat, access an exhibition, make a payment, or access and use toilet, baby changing or breastfeeding facilities or a smoking area. Statutory Rule 2021, number 251, Amendment number 15, commenced on the 10th of September following executive agreement on the 6th of September. This amendment removed the requirement to obtain a ticket in advance of an indoor theatre or concert event and the requirement to have allocated seating. It permits dancing at a wedding or civil partnership reception and enables persons to play a gaming machine or play a game such as pool, snooker or darts. It removed the requirement to be seated at a table to order food and drink, and for outdoor hospitality, people are no longer required to be seated to consume food or drink. It also no longer restricts music to ambient level, and it increases the number permitted to gather indoors at a private dwelling from 10 to 15 persons, not including children aged 12 or under, from a maximum of 4 households. Due to a rescheduling of the Assembly debate, this amendment also revoked Statutory Rule 2021 number 172, Amendment number 7, and reinserted the text into this amendment. The original amendment would have exceeded the obligation to be approved by the Assembly within a 28-day period and would have therefore fallen. This ensures the continuity of the regulation formerly contained in Amendment number 7. Turning now to the 3 amendments to the Health Protection Coronavirus Wearing of Face Coverings Regulations Northern Ireland. Statutory Rule 2021 number 216, Amendment number 3 to the face covering regulations was a technical amendment to extend the expiry date of the regulations from the 23rd of July 2021 to the 24th of March 2022. This amendment commenced on the 23rd of July. Statutory Rule 2021 number 219, Amendment number 4 to the face covering regulations were made and commenced on the 27th of July, and removed the requirement to wear a face covering in a place of worship or a place where beliefs are practiced when attending an act of worship. Face coverings are still legally required when entering or exiting the building. This amendment also enabled vehicle examiners in a vehicle testing centre to remove their face coverings except when in a vehicle with a member of the public. And finally, following executive approval on the 6th of September, Statutory Rule 2021 number 250, Amendment number 5, exemption to enable face coverings to be removed when dancing at an event to celebrate a wedding or civil partnership. Okay, so I've now finished summarising the 11 amendments to be considered today. I trust that members have found this helpful, and Nigel and I are happy to take any questions that members may have. Thank you.
Okay, thank you, Marion. First of all, from me, in relation to the more general easements or restrictions, has there been, or how do you track what impact that has on transmission out in the community? And my purpose in asking that question is, are we learning the right lessons here in terms of what it takes to address community transmission of COVID-19 now and into the future, so we know which measures are potentially increasing spread or which measures are better at suppressing transmission? So are those specific regulations being tracked in terms of their impact?
Chair, maybe if can you still hear me, Chair?
Yeah, I can hear you, and your camera is better now, Nigel. We can see you there now. Yeah.
Good. Thank you very much, Chair. It's very, very difficult to follow the impact of any individual restriction. Obviously, the combination of restrictions is having an impact, as is a range of other things like personal behaviours and the impact of the vaccination programme. What I would say is that the executive are presented with a wide range of information, including what's happening in terms of case numbers and hospital admissions and indeed what's happening in terms of track and trace and information from the PHA on outbreaks and clusters. So each time the executive is considering the current situation, it is able to see whether there's any particular signal in the health data that might be attributed to the previous decisions that they've made. And looking forward, of course, some of the modelling is able to, well, it's not a prediction, but some of the modelling is able to suggest what might be the impact of some of the decisions and some of the changes like the return to school and return to college and so on and so forth. So on occasion, you're able to see a decline or an increase and make a fair assumption that it's as a result of previous decisions. But it would be very difficult to apportion that change to any particular restriction or regulation change.
Okay, thank you. In relation to the face coverings specifically, what monitoring is done on the compliance of the ones that remain in place? Because I have to say, anecdotally, when I go out now to shops, shopping centres, hospitality, all of these settings, there's a very noticeable reduction in mask wearing. It's particularly noticeable in relation to the situation in the south. And that's very worrying in terms of the fact that we are seeing the levels of new cases per day, over 1,000, and the pressures that are on the hospital services and on staff. So how do you monitor and track compliance levels out there in the community?
I'm not sure if Marion would like to add anything to what I would say. I mean, there's no formal monitoring program in terms of compliance. Obviously, in terms of enforcement, where we have PSNI officers and officers from the council in various settings, then non-compliance with the mask wearing is one of those things. So there would be some data on enforcement in terms of number of penalties issued for that sort of thing. But I think it's just one of those areas where we're very much relying on people being responsible and taking the necessary action to protect themselves and others in the community. I think that's going to be more and more the case as we go into further relaxations. TransLink do produce or have in the past produced some figures in terms of their own compliance monitoring on public transport. But in terms of in shops, hospitalities and other indoor places generally, there'll be no formal programme for monitoring that. The Chief Medical Officer, Chief Scientific Advisor and the Minister did write recently to councils and to the police, really just to emphasise the importance of the enforcement going forward of the remaining restrictions. We appreciate that's always going to be quite a difficult thing to do in practical terms as things ease and people's attitudes and behaviours change. But we're probably in that sort of territory now where the messaging will become increasingly important, and the public messaging around the need to continue with those very basic measures around mask wearing and hand washing and sanitisation and social distancing where possible.
Well, I suppose I'm at a bit of a loss, Nigel, in the sense of that if no formal compliance monitoring is taking place, then how do you measure effectiveness? Or indeed, how do you target the campaign you've suggested or measure the effectiveness of that if you don't have a baseline? So how do you if there's no formal monitoring of it, how are we going to get the information that we will need to proceed in the future?
Well, I think the focus will be on public messaging going forward, and obviously then in terms of the overall impact that we've discussed already and what we're seeing in the numbers, then need to give further consideration to whether you need to take more steps in the future going forward. I think a particular issue with face coverings, of course, is the exemptions that are available and the fact that it's not always possible or acceptable to challenge people who are not wearing a face mask as to whether they are indeed exempt or the reasons why they're exempt. And I think that's an added complication in terms of viewing compliance.
Yeah, and so how do you know if the communication measures are needed and what messages are needed, to address the lack of compliance or to ensure effective use in a public health sense?
Yeah, well, the Executive Information Service and the partners that it works with are currently reviewing the messaging that will be required or going forward over the autumn winter to have maximum impact. Not sure what the detail of that will look like yet, but it's these sorts of issues that you raise that will need to be at the forefront of the thinking on whatever new public messaging is issued.
Yeah, because I think one of the things the committee has emphasised from the start is that we would want to see learning. We understood way back at the start of this that people were kind of coming up with new measures with a new pandemic, but there would appear to be a lack of focused learning. And going back to my first point in relation to the impact of the various measures, we have heard previously that the executive get a summary of that. So what information does health hold in relation to the impact? And you said it's difficult, and I accept that, but what are you doing to address those difficulties and ensure that we can learn and measure and move forward more effectively?
I think we are certainly learning as we go along. Obviously, there's been a lot of research going on in parallel from a wide range of sources as well. And that more and more of that becomes available as time goes on. And the committee be well aware with SAGE and the fact that that particular group takes that evidence as it emerges on board and distills that, if you like, to help provide policy advice to government going forward. So that's happening all the time. We also have different measures being used in different parts of the UK, also in the Republic of Ireland. And to some extent, we're able to take learning as well from a divergence that occurs from time to time in terms of case numbers and other things in other parts of the UK and Ireland as well. So we are learning, I would argue, all the time through that. In terms of what we can do, as I say, we're in one might describe as a transition period at the moment where we have already relaxed quite a lot of things. The executive are considering all of the remaining restrictions effectively at each meeting. And of course, there's a lot of focus now on autumn, winter and the other pressures that are associated with that in any case. So I think there's no lack of effort in terms of trying to take on board what we've learned already and what the autumn, winter might look like. But we are moving probably, certainly in the short to medium term, to relying more on public messaging and guidance than we would be on bringing in more legislation.
So can you forward that previous learning then that you have gleaned, can you forward that to the committee?
Well, Chair, all of the papers that emerge from SAGE that summarise the research are available on the SAGE website.
No, sorry,
and the Chief Scientific Advisor provides the executive.
Nigel, I'm not asking you to direct us to do a trawl of SAGE. I'm asking you to provide this committee with the learning that you have referred to there, that the department here have completed or have in their possession, to forward that to the committee. That's what I'm asking.
I can certainly understand the request, Chair. I'm not sure that's easily done. I mean, it occurs in a variety of ways. Obviously, there are a lot of meetings that occur with various different groups in the UK where various measures taken in the different jurisdictions are discussed. A lot of that, isn't necessarily recorded in a way that could be shared. That's simply discussions amongst officials and in other expert groups about what they're learning from the activities that they're involved in going forward. So it's not a particular document or report that could be shared. It's a sort of an ongoing process.
I have to say that worries me, Nigel, because we are in a situation where this is still an active pandemic. There's still a potential for further variants to put us into significant difficulty again. Never mind the fact that we are experiencing high levels of transmission at the minute. So by this point, I would expect the department to be able to show its workings out, to be quite honest. And the fact that you're saying there was previous learning, but that was just really discussions, this needs to be captured and communicated and understood. I find that very, very worrying that the department 20 months on are not formally capturing the learning and then developing that learning into further solutions.
Well, clearly it's still a very live and fluid situation. The process, as you know, in the executive is that, proposals are considered by the executive collectively. the health data and learning input primarily through CMO, CSA, is given to them at every meeting, and they're considering that along with the other evidence and learning provided from all of the other departments in relation to the things that they're responsible for, be that the economy or the wider impacts that they're seeing occurring in society. So the executive are presented with an awful lot of information and data, and some of that clearly, is learning as well from other jurisdictions and so on and so forth. But it's not, in a format that it would be simple to provide. For example, it's not for our department, but obviously there's been a lot of talk this week about the high street stimulus and the stimulus and the prepaid card and so on. From the media reports, it suggested that that idea was taken up from Jersey. I've heard officials from Jersey saying they should have shared a lot of learning from that with the Department for the Economy. So just one example of where certain proposals or ideas are coming forward as a result of things that have happened elsewhere, but that information isn't necessarily put together in a published form at this time that could be made available easily to the committee.
I don't understand how it's in a format that's hard to provide. I just don't understand that. Surely it is able to be provided in a written format and shared with the committee, because surely it has been shared with the executive. So just to try to get my own head around this, can you give me an example of an actual measurement that you have provided to the executive to underpin a recommendation that you have either made or that you are agreeing to in the executive?
Well, from a personal perspective, Chair, I'm not involved in making any recommendations or providing any evidence to the committee to the executive whatsoever. Primarily, the route for that is through Chief Medical Officer and Chief Scientific Advisor, who provide verbal reports and papers to the executive at every meeting.
But you're the official who's here today to brief the committee on these measures. So can you make it your business to find that information out from the Chief Medical Officer and come back to the committee with that information?
Well, in fairness, Chair, the executive has its collective deliberations, which as officials we're largely unsighted on. We're then provided with some information on what has been decided collectively at the end of the day. And where that involves a change to the regulations, we are then charged with working with the Departmental Solicitor's Office to make those changes in law. So our role in our team on our side is effectively to implement the executive's decisions insofar as they relate to the need for a legislative change. We're not involved in providing proposals to the executive or indeed to have necessarily have sight of the information that they're considering when making their decisions. That would be a matter for the executive to decide to release that information.
But surely the department are providing the underpinning information to make those decisions?
The Chief Medical Officer, Chief Scientific Advisor will provide both verbal and written reports to the executive, including the paper commonly known as the R paper, which summarises the current position as regard the progression of the pandemic, and those papers are published on our website after each meeting.
Okay. I find that all very vague and very hard to get any actual traction on, but you've mentioned the R paper there. What is the current figure on R at the present time?
Currently, as far as the last week is concerned, hospital admissions have increased while the occupancy has remained stable. The IC occupancy and deaths are relatively constant.
Sorry, Nigel, your sound has broken up there. Could you just repeat that again? I'm asking you what the R number is at present.
Okay. I was giving you sort of slightly broader information, but the RT for cases and for admissions to hospital is both around 1.
Sorry, you were breaking up there. We didn't get that information, Nigel.
Okay.
Try it again, please.
Still hear me?
Yes, hopefully we can hear you better.
Okay, in short, RT for numbers of cases and admissions to hospital are both around 1.
Both around 1?
Yes.
Yep, okay. Okay, thank you. Listen, I'm going to move on to other members' questions. I'm going to move on to other members' questions for now. So I have an indication from Jerry and then from Paula.
Thanks, Chair. Thanks, Nigel. First question, the amendment around the UEFA Super Cup, I think it was. Has there been any modelling of cases of COVID from that event?
I'm not aware of that. I don't know if Marion, you have any information on that?
Nothing of specific detail. I believe there was a report being done by the Executive Office to follow up on that, but I'm not sure on the detail of that or if that's been completed.
Okay, can we get that information report? I mean, obviously, you know, I wouldn't begrudge anybody going to a football match, but if there's been a significant increase in COVID cases from that, then at the very least the committee should be aware of that. So I'd like to request we receive that paper or report. Some other questions. There's obviously, you'll both be aware, calls to remove all restrictions by the end of this month, I believe. Has the department done any work as in to indicate what the effect of further increases of COVID will be if that was to be the proposed and accepted path?
Jerry, I'm not aware that there's been any specific modelling done on that. It hasn't, to my knowledge, come forward as a formal proposal yet, and it's certainly not something the executive has agreed on. So I don't believe that we have looked at that specific scenario.
Okay, well obviously you'll be aware that it's doing the rounds in the media quite strongly. I appreciate there hasn't been a position taken, but I would respectfully suggest that the department looks at that and does some modelling, if it hasn't already, around projected increase in cases of COVID if all restrictions are removed. Just two quick final points, or questions rather. Amendment number 4 requires or allows the face covering in places of worship to be removed. I've had a number of people who attend places of worship concerned about the likely increase in cases from that. Has there been any modelling, research or investigation as to a possible increase in cases from that? And then finally, I think it's number 15 amendment around the requirement, the regulation for seated hospitality to be lifted. I mean, what is the modelling, the work, the research, and the investigation, call it what you want, into how cases may rise in these environments and the impact on the public generally in those places, but also obviously hospitality workers specifically? That's me.
Yeah, those both, Nigel? Yeah.
Yeah. Sorry, Marion, are you able to say anything on that?
Not in terms of modelling, no.
Okay. I mean, I think it's pretty major stuff, you know, and I think at the very least as a committee we need to get access to this information if it exists and we're not getting it as an issue there in and of itself. But if it's not being looked at or researched, then I think there's major alarm bells going off in my head. So I don't know how to proceed, but I think we need to get this information. So if somebody can enlighten me whether it exists or not, I would be grateful. But I'm a bit disappointed in the information.
Okay,
Chair,
thank you.
just add that we'd be quite happy to contact you on that. It's just the fact that we're obviously on our side in the regulations, we're not engaged with the on the modelling side of things, so it's very difficult to comment on what has or hasn't been happening with that.
Yeah, but obviously it will have an impact on whether there should be regulations lifted or not. So I think it's quite connected, even if all the information isn't known off by heart. I think at the very least being aware of that information would be useful. But I'll leave my questions. Thanks, Chair.
Okay, thank you. Going to Paula, and then I'm going to go back to Pam. So Paula, please.
Thank you, Chair, and thank you for the update this morning. I think my questions will probably be just as frustratingly unanswered as the previous two contributors, because I think that we need potentially the Chief Scientific Advisor at the very least to come before Health Committee, because a lot of what we're wanting to know is more the evidence base and the thinking and the way in which the information is being captured whenever the regulation is in place. But I'll go ahead with my questions in case they can't be answered, but I just want that suggestion to sit for the Chair. The first one is in relation to the indoor gatherings, where they've changed to, let me just get this right, from Friday there are 15 people from 3 households, except for one household has 10 people in it. What is the evidence behind that proposal, that regulation? Is quite complex. How do we know that how that will affect behaviour, and how well do we think that could actually be enforced and is known within the community, the people potentially having indoor gatherings? Thank you.
Paula, the regulations have changed to 15 people from 4 households now, and that exemption for larger households is now all aligned under the one private dwellings gatherings for that. That exemption was put in to enable them larger households of maybe 10 or more people to have visitors, and obviously the number of households that would have been able to utilise that exemption would have been limited, and therefore, whilst there could have been inevitably an increased risk that you'd expect with the more people gathering indoors, that risk would have been limited as well because of the number of households that would be able to use that.
Okay, no, thank you, appreciate that. It's just going off the Health Committee notes, and I suppose that cuts to the issue of how families behave. So I suppose that's been rectified in some regards, but it's the enforcement in many ways and the behavioural science behind it. The second query is in relation to outdoor gatherings, and I suppose on NI Direct they're talking about where they are organised, but what we're seeing in the Holy Land area at the minute are outdoor gatherings where there are thousands of students and young people gathering every night till 2 and 3 in the morning. So my question is, where are the health protection regulations in terms of enforcement? Are fines still in place? Can they still issue fines and other notices through the police or through councils? I just think we're a wee bit lost in that, and when you see what's happening in the Holy Land, I mean, it's just a complete free-for-all, and you wouldn't know that we were still in the middle of a pandemic.
Well, the limit on outdoor gatherings has been removed, so there's no limit in terms of how many people can gather, and there's no longer a social distancing requirement under the regulation, but obviously health still advise people to social distance where possible, but in terms of regulations, that's no longer in the coronavirus restrictions regulations.
So there's no powers really for the police then in terms of fines or anything else around dispersal then? It's more just a guidance at this stage?
Not in terms of social distancing. I'm not familiar with what other powers that the PSNI might have to deal with those types of gatherings, and maybe in terms of antisocial behaviour, but in terms of social distancing, no, they're no longer in outdoor areas. That's no longer a requirement.
Okay, I was taking it off the organised outdoor gatherings, and I was aware that in these sort of free-for-all where there's hundreds of thousands of students, then obviously it's not been organised, but it's more just how the statutory authorities can respond to that. The next question in relation to the forthcoming introduction of 12 to 15-year-olds who are being vaccinated in schools, and that's really around, is there anything, are we going to be getting regulations around that, or is that just going to be issued in guidance form to the schools as to how that's delivered? I'm conscious, like last night I coach junior hockey, and some of the girls were saying, I'm not going to get vaccinated because I hate needles. And I'm just wondering how are we going to get regulations around the information they're communicated with, how it's been delivered, but also trying to capture where there isn't uptake. Why not? To again link into the behaviour behind the reluctance to take it up.
Well, I'm not actually involved in the vaccination programme. I would have to obtain information unless Nigel's able to provide input into that, and I'm not aware of any plans of regulation for it, but unless Nigel can...
I'm just thinking, given the age group, i.e. they're minors, whether or not the provision is going to have to come forward in terms of health protection regulations or other form of statutory footing.
Paul, all I could say is there'll be no plans to include anything on vaccination in the restriction regulations, and I can't imagine that would be appropriate. As Marion said, don't know what the thoughts on the vaccination policy side are. Be very surprised if they were considering legislation around things like mandatory vaccination, which would be very controversial.
I'm certainly not talking about mandatory. I'm talking about the statutory framework within which young people can access or are offered the vaccination programme, where it's not obligatory, where we have the HPV, which obviously is something that, is already embedded in practice. So it's more just to see how that's going to be rolled out and whether there's any legal challenge around it if regulations came forward. But again, I think that some of this stuff would be better directed at Patricia Donnelly or Professor Ian Young, because I think a lot of them are more policy issues rather than legislative. Thank you.
Thank you, Paula. And going then to Alan Chambers. Go ahead, Alan, please.
Thank you, Mr. Chairman. Mr. Chairman, I can understand the frustration of members this morning who feel that they're not getting the answers that they want to the questions that they're asking. But I think, in fairness to the two officers that are here, Nigel and Marion, they play, as they've pointed out, a specific role in this whole process. And if we want to dig deeper than the role that they play, then surely it is incumbent on us to invite along to the committee those people who can provide the answers. And it's quite clear that neither of the officers are deliberately trying not to answer our questions. They simply, it's not within their remit to do so. And I keep banging on about bringing a representative from the Executive Office, and I don't know, the committee seems to be really stonewalling against that, and that's where you might get some of the answers that we want, that we've been asking this morning. The Chief Medical Officer, he gives his advice. We can bring him along and we can quiz him all day long about the advice that he gives to the Executive. It may well be that advice is privileged, and without the authority of the Executive, he would not be able to actually share the advice with us that he gives to the Executive. So again, even if he did come along and explain what advice he gives, it's the people, the Executive, that actually disseminate that advice and make the final decision. So therefore, those are the people that we really need to be asking, why have you made a decision? What's your rationale behind it? And as I say, so if you want answers to those questions, we've even asked questions this morning of the officers around vaccinating. Again, I think, as Paul has acknowledged, that if you want to ask questions about vaccinating, it's Patricia Donnelly you have to bring along and ask. So I think, we have to be fair to the officers that are in front of us and acknowledge the fact that they can only answer questions that lie within their remit. And I think that if we do want to dig deeper, then we do have to give consideration. And I can't understand why there seems to be such a reluctance to ask the Executive Office to send somebody along to assist us in the scrutiny that we quite rightly have to apply to this whole system. Thank you, Mr. Chairman.
Yeah, thank you, Chair. I actually don't disagree with anything Alan said there. I think we need to be fair to the officials in front of us in our expectation of the questions they can answer. I think we're all frustrated, and we would all like to see the full evidence of behind all decisions that are made. But also, I think we have to recognise that the regulations that have been in and how they change are really the types of things that none of us ever envisaged ever having to scrutinise, never mind bring into effect. But I suppose I have a happier question maybe for you, Nigel, and that's around the dancing. So good news for those wanting to get married or enter into a civil partnership that they're allowed to dance. But could you just answer, because I've been trying to get an answer to this recently, and it's in terms of dance teachers. So I'll give you an example of a dance teacher who trains up couples to dance in like a charity Strictly Come Dancing type event. Are they allowed to operate under the current regulations or not? I'm not sure whether it may come under sport, because obviously it's very specifically, very specific individuals dancing with each other. So I don't know if you can help us out with that query. It's just that I certainly have a constituent who hasn't been able to work for the entirety of the pandemic because of the regulations, and we're still unclear as to whether they're able to do that now.
Thanks, Pam. I think maybe Marion might be better to answer on the detail of that.
Yeah, that's grand. The restriction on dancing only relates to licensed premises and unlicensed premises. So the likes of any, if the training, the dance was taking place in any other venue, then that's absolutely grand. The dancing, as I say, is only restricted in the hospitality industry, apart from the weddings, or if it was a theatre performance, for example.
That's brilliant, Marion. Thank you very much.
Okay, thank you. Okay, Nigel and Marion, thank you for coming along to committee. We don't have any outstanding, Keith, no? Thank you for coming along to this morning's committee, and we will await the information that you have committed to bringing back to us. We'll await to see that, but I do think there is a lot of room for further clarity on what types of measurements are being taken, what type of monitoring is being done, on the impact of putting in place restrictions or removing them in terms of all of that. And I think that is a genuine concern of the committee, and one that is appropriate for a department to address via whatever format that may be, but to provide us with some indication as to how these decisions are being assessed. I think that's relevant and appropriate. But anyway, I want to thank you both for your attendance this morning, and to wish you all the very best in time ahead. Thank you.
Thank you.
Okay.
Thank you, Chair.
Yep, Jerry.
Thanks, Chair. No disrespect to the officials, but I think it's pretty astounding that we're being asked to accept amendments and changes, and with no real, not only information about the impact of them, but no knowledge or limited knowledge of whether even research has been done somewhere around the impact of these regulations. So, it's frustrating, but it's also limited in our ability as committee members to make, I think, informed decisions. So I have no idea what the resolution is to it, but I just feel that we'll have to address it somehow. The fact that these were obviously delayed, give the department an extra week to maybe consider possible questions from members. And, yourself and the questions that I raised are not left field questions, they're pretty mainstream questions. So yeah, I'm pretty frustrated by the lack of information or even direction on where information may exist around this issue. It's a bit frustrating, to say the least.
Yeah. In terms of timing, Clerk, what's the situation?
These are due to be debated on, I think it's Monday or Tuesday. So it is, I think it's Monday. Now, the committee's options for today are to either agree that the rule be made or not. Now, in the end, it's down to the Assembly to do that on Monday on all the regulations. I understand the frustrations of members in relation to, it's been brought up before around evidence that backs up the regulations. It's in the chair's speech near enough every time they're discussed. But there is a limited amount of time now that they're being considered on by the Assembly on Monday. And today we would put the question as to whether the committee are content that it be confirmed or not be confirmed is really the only two options that we have at the minute.
And once again, that leaves us with the difficulty around public confusion and perception and all of that. But I do think we should be writing once again to the department, explaining, outlining our concerns around the lack of. And I mean, I don't see that in terms of the advice provided to the executive. Surely there are examples, and they can demonstrate what they're basing that advice on, and that's what we're asking them to do. And I think that we write to them, outlining that, and potentially asking for a session with the CMO or whoever it may be, who can come and explain. If the officials weren't able to do so today, then we go to the Chief Medical Officer or whoever, and the Chief Scientific Advisor, and ask them on what basis they are then providing the advice to the executive. Would members be content? Pam?
Yeah, Chair, we did have the CMO in attendance, or the CSA, or maybe both at times. Have we not before when looking at these?
Not with the regulations.
Not with the regulations. So perhaps we should simply be asking for whoever is required to attend. To answer.
Whoever can answer it, yes.
Exactly.
Yeah, I do agree with you.
Let's not argue about who that is.
The other thing is, as time has gone on, I would expect the department to be able to demonstrate and to do more. So that is also the fact that we have addressed it in the past. I think now that we've moved on, I would be expecting the department to be refining how it is they are measuring the impact of the various measures, either putting them in place or removing them, so that in the future, as we're dealing with this pandemic, as we continue to deal with it, the decisions get better and better. But I agree with you that we should ask them for whoever can answer those questions to come to the committee. Yes, Alan, go ahead.
Yeah, thanks, Mr. Chair. I don't disagree with that. I think we need to know what's behind it, and obviously if we're going to do our scrutiny role, we do need to have the fullness of the information. But can I just ask, Chair, why is there a reluctance to ask a representative from the Executive Office to come along and explain how they interpret? It's not how we interpret the information and the advice that's given by the Chief Medical Officer, because we don't make the decisions, we scrutinise them. But do we not have a role in scrutinising how those decisions are arrived at and what the rationale is behind them? I think it's not unreasonable to ask the Executive Office. We don't know whether the Chief Medical Officer's advice has been followed on all occasions, or whether it's been watered down, or whether there's, I suspect there's maybe compromise at times around the advice and a meeting of minds rather than clear-cut decisions been taken by the Executive. But could somebody explain to me why we are so reluctant to ask somebody to come along? And this is not to preclude all the other people that will want to bring along. I have no difficulty with that. Bring them all. But can somebody explain to me why we are reluctant to invite somebody from the Executive Office to come along and join in that discussion?
Well, from my own perspective, I have no issue whatsoever with, and we have had executive officials from the Executive Office in here before. But what I'm trying to get an understanding of at this point is how they are measuring the impact of measures, and then how that informs the advice they give. So to me, that's step one in terms of the Department of Health. How are you assessing the worth or value of any of the measures? How's that being measured now that we're 20 months into the pandemic? So that's the first thing. I have no issue whatsoever then with going to the Executive at a later stage and saying, how then are you assessing the information you're getting? But at this point in time, we have no idea what type of information, what type of measurements is being provided to the Executive. And I would like to know that before I would go to. But I would have no issue in principle with going to the Executive Office in that sense. But I think we first of all need to understand how the Department of Health are assessing what it is they provide the Executive with.
Mr. Chairman, I'm quite happy to be corrected in this, but I have no immediate recollection of anybody from the Executive Office appearing before the committee in recent times, and I would have thought in the middle of this pandemic that there would have been a regular attendee at the committee, but I don't, as I say, I stand to be corrected, but I have no recollection of it.
Well, I will also go back to Just to say that we do have a statutory duty to scrutinise the Department of Health and a very, very full schedule. So when you refer to us bringing in executive on a regular basis, there is a committee that scrutinises the executive office. My recollection is we certainly have had officials from the executive office at times.
We definitely had them on the travel rigs.
Yeah.
I would check on the coronavirus rig, so well, just to see in the past, but.
Carol was looking in there. Carol, go ahead, and we'll need to move this on now, members, as well. So, Carol, please, briefly.
You've made the point. It's not that there's a reluctance to bring TEO in. It's just that this is a health committee. TEO make recommendations based on what is advised by the CSA, CMO, and the Department for Health. So, if there's a combination of all those coming in to advise on this, I don't think anybody has a problem. It's been done before. Karen Pearson was at the committee, so. It's not that there's reluctance, it's really appropriate that as the Committee for Health, we get the department officials from the Department of Health to talk to the regulations or asking the Committee to Health to agree.
Yep.
Chairman, if I could just come in and ask, what is our proof that the executive who make these decisions are indeed following the fullness of the advice of the Chief Medical Officer and the Scientific Officer? I've no indication of it, and what goes on behind closed doors at the executive, I understand it stays there. So it would be reassuring to me as someone who is part of the scrutinising process to be able to scrutinise everybody that's involved in it. I know that our main primary objective is the Health Committee, but I think that this is such a serious pandemic that we're in. I think we should be able to spread our wings as far as we wish to get the answers that we need.
Well, you see, for me, you can't spread your wings if you're not even able to get off the ground by finding out what it is the department are providing. I think that's putting the cart before the horse, to be quite honest. I would like to know how the Department of Health are formulating the advice that they give to the executive. I think that's fair, and I think, with all due respect, Alan, the committee members feel that as well. At a future point, but at this point in time, I would like a further scrutiny and a further explanation from the department in relation to how they're assessing the impact of the measures, and that is before it goes to the executive.
You're saying that the rest of the committee have an opinion. I actually share that opinion. I agree with them all. I hope that nobody thinks that I'm trying to swim against the tide here. I'm trying to do, as a scrutiniser, to try and do my job to the absolute best of my ability. And I've no problem with bringing the Chief Medical Officer. As I said earlier, bring everybody along. But this always seems to be portrayed as if maybe somehow I'm resisting bringing certain people before the committee. I'm not. Bring them all. But I think that there are other people who we need to be asking questions of, and I hope that going forward we will do that. Thank you.
Okay, members, I'm going to move in then to formal consideration of each of the measures that we've just discussed. So we'll consider each of the SRs in turn. All of them are subject to the confirmatory resolution procedure, and they are expected to be scheduled for plenary debate on the 20th of September. I can advise members that the Examiner of Statutory Rules has no comments to make in relation to any of these at this time. So, members, I'm going then to item 7, SR 2021-197. Have members any issues they wish to raise in relation to this SR? No? If not, then can I ask members to agree formally that the Committee for Health has considered the Health Protection Coronavirus Restrictions Regulations 2021, Amendment number 8, Regulations NI 2021, and recommends that it be confirmed by the Assembly. Are we agreed? Agreed. Thank you, members. Item 8 is SR 2021/199. Have members any further issues they wish to raise in relation to this SR? No, thank you. If not, then can I ask members to agree formally that the Committee for Health has considered the Health Protection Coronavirus Restrictions Regulations 2021, Amendment number 9, Regulations 2021, and recommends that it be confirmed by the Assembly. Are we content? Thank you. And members, just to state that statutorily we need to go through each and every one of these, so just that there will be quite a list of them here. Item 9 is SR 2021/201. Have members any further issues they wish to raise in relation to this SR? No, thank you. If not, then can I ask members to agree formally that the Committee for Health has considered SR 2021/201, the Health Protection Coronavirus Restrictions Regulations NI 2021 regulations, and recommends that it be confirmed by the Assembly. Are we content? Agreed. Thank you. SR 2021/216. Have members any further issues to raise in relation to this SR? No, thank you. If not, can I ask members to agree formally that the Committee for Health has considered the Health Protection Coronavirus Wearing of Face Coverings Amendment No. 3 Regulations NI 2021 and recommends that it be confirmed by the Assembly? Agreed. Thank you, members. Item 11 is SR 2021/217. Have members any further issues they wish to raise in relation to this SR? No, thank you, members. If not, then can I ask members to agree formally that the Committee for Health has considered the Health Protection Coronavirus Restrictions Regulations 2021, Amendment No. 11, Regulations 2021, and recommends that it be confirmed by the Assembly? Are we agreed? Thank you. Item 12 is SR 2021/219. Have members any further issues they wish to raise in relation to this SR? No, thank you. If not, then can I ask members to agree formally that the Committee for Health has considered the Health Protection Coronavirus Wearing of Face Coverings Amendment No. 4 Regulations and NI 2021 and recommends that it be confirmed by the Assembly? Are we agreed? Thank you. Number 13, SR 2021/220. Have members any further issues they wish to raise in relation to this SR? No, thank you. If not, then can I ask members to agree formally that the Committee for Health has considered the Health Protection Coronavirus Restrictions Regulations 2021, Amendment No. 12, Regulations NI 2021, and recommends that it be confirmed by the Assembly? Are we agreed? Agreed. Thank you, members. Item number 14, SR 2021/224. Have members any further issues they wish to raise in relation to this SR? No, thank you. If not, then can I ask members to agree formally that the Committee for Health has considered the Health Protection Coronavirus Restrictions Regulations 2021, Amendment No. 13, NI 2021, and recommends that it be confirmed by the Assembly? Are we agreed? Agreed, thank you. SR 2021/233. Have members any further issues they wish to raise in relation to this SR? No, thank you. If not, then can I ask members to agree formally that the Committee for Health has considered the Health Protection Coronavirus Restrictions Regulations NI 2021 Amendment No. 14 Regulations and recommends that it be confirmed by the Assembly? Are we agreed? Agreed. Thank you, members. Number 16 is SR 2021/250, the Health Protection Coronavirus Wearing of Face Coverings Amendment No. 5 Regulations NI 2021. Have members any further issues they wish to raise in relation to this SR? If not, can I then ask members to agree formally that the Committee for Health has considered the Health Protection Coronavirus Wearing of Face Coverings Amendment No. 5 Regulations 2021 and recommends that it be confirmed by the Assembly? Are we agreed? Agreed, thank you. SR 2021/251. Have members any further issues they wish to raise in relation to this SR? No, thank you. If not, then can I ask members to agree formally that the Committee for Health has considered the Health Protection Coronavirus Wearing of Face Coverings Amendment No. 5 Regulations 2021 and recommends that it be confirmed by the Assembly? Are we agreed? Agreed. Thank you, members. Okay, members, moving swiftly on as time is pressing now on us in relation to the next group of SRs, which are at agenda items 18 to 24, and these relate to international travel. I refer members to the papers at tabs 18 to 24 of the pack, and in particular to the Clerk's memo at tab 18.1. Department officials are here to brief the committee on the content of these SRs, so I'd now like to welcome by video link Carol Picton-Linus, who is Head of Health Protection, Branch 3. Carol, can you hear us okay there?
Hello, Chair. Yes, can you hear me okay?
Yep, we're hearing you fine, Carol, thank you. And also Deborah Sharp, who is Deputy Head of Health Protection within Branch 3. Can Can you hear us there okay, Debbie?
Yes, I can, Chair. Can you hear me?
Yep, hearing you fine, Deborah, thank you. Okay, so I'm now going to go back to check with yourself. Carol, is it yourself or Deborah who's briefing? And then we'll go to members' questions.
It's myself, Chair, if you don't mind. Thank you.
Thank you. Yep, go ahead.
Okay. Well, thank you very much for the invitation to attend today's meeting of the committee. The committee is considering 7 statutory rules which have been made under negative resolution procedure, which generally underpin executive decisions taken in relation to international travel at their meetings during July and August of this year. If I may make an overarching summary of the suite of regulations the committee may wish to consider today, they are SR 2021 numbers 189, 213, 214, 215 and 230. They are the first, second, third, fourth and fifth amendments made to 2 sets of travel regulations, namely the Health Protection Coronavirus International Travel Regulations NI 2021 and the Health Protection Coronavirus International Travel Operator Liability and Information to Passenger Regulations 2021. SR number 2021 number 218 and 241 make amendments solely to the principal regulations, namely the Health Protection Coronavirus International Travel Regulations 2021. This suite of regulations underpin the Executive's agreement to align with the UK and the UK government and the other devolved administrations in relation to the relaxation of border measures in relation to international travel and the 3 weekly cyclical review of the red, amber, green traffic light system in relation to countries. The regulations make technical amendments and introduces exemptions for certain groups of persons travelling from amber list countries from having to undertake post-arrival testing and self-isolation. So if the committee is content, I will briefly summarise each set of regulations in the order in which they were made. The first set of regulations is 2021 number 189, the Health Protection Coronavirus International Travel and Operator Liability and Information to Passengers Amendment Regulations. They came into force on the 30th of June 2021. These regulations made changes to the Health Protection International Travel Operator Liability and Information to Passenger Regulations and to the principal regulations, the Health Protection Coronavirus International Travel Regulations 2021. These regulations were made to remove an operator's liability from bringing a passenger who has not completed a passenger locator form or is not in possession of a negative pre-departure test result to Northern Ireland if that passenger is being lawfully compelled to travel to the UK in the course of an extradition, prisoner transfer or deportation. The regulations also revised the on-board public health announcement on commercial passenger conveyances arriving in Northern Ireland to the effect that passengers are made aware that they must still take a day 2 PCR test even if they have been fully vaccinated. The regulations also add a number of countries to the red list, which were Dominican Republic, Eritrea, Haiti, Mongolia, Tunisia and Uganda. And these countries were added to the red list owing to an increase in the risk of variants of concern. A number of countries were also added to the green list owing to a decrease in risk of VOCs, variants of concern, and they were Anguilla, Antarctica, British Antarctic Territory, Antigua and Barbuda, Balearic Islands, Barbados, Bermuda, British Indian Ocean Territory, British Virgin Islands, Cayman Islands, Dominica, Grenada, Madeira, Malta, Montserrat, Pitcairn Islands, Turks and Caicos Islands. They were added to the green list. So these regulations also include a new exemption for passengers transiting to Guernsey, Jersey or the Isle of Man via Northern Ireland from the requirement to possess a day 2 and 8 testing package on arrival, as these Crown dependencies manage their own testing regime, and the regs remove the residency exemption for specialist aerospace engineers or workers so that they are exempt from self-isolation whilst undertaking the exempt activity. The regulations also remove the direct flight aircraft ban from Argentina, Brazil, Cape Verde, Chile, Ethiopia, the Maldives, Oman, Qatar, South Africa and United Arab Emirates, as no direct flights from these countries come into Northern Ireland. Moving on to this next set of regulations, SR 2021 number 213, these the Health Protection Coronavirus International Travel Operator Liability and Information to Passengers Amendment number 2 regulations, they came into force on the 19th of July 2021, and they made changes to the Health Protection Coronavirus International Travel Regulations and the Health Protection Coronavirus International Travel Operator Liability and Information to Passengers Regulations. These regulations were made to amend the international travel regulations so that a fully UK vaccinated amber list arrival does not need to self-isolate or take a day 8 test, bringing the requirements in line with green list country arrivals. The regs also added Cuba, Indonesia, Myanmar and Sierra Leone to the NI Red List owing to an increase in variants of concern. The regs also added Bulgaria, Croatia, Hong Kong and Taiwan to the Northern Ireland Green List owing to a decrease in risk in variants of concern, and to remove the Balearic Islands and British Virgin Islands from the Green List. They also introduced a new exemption category for fully vaccinated arrivals from amber list countries. These travellers are exempt from the requirement to self-isolate and take the day 8 post-arrival PCR test. The traveller must have proof of their exemption status and make the appropriate declaration on their passenger locator form. The regs also impose obligations on travel operators to check the evidence held by travellers claiming fully vaccinated exempt status, and they must have systems and processes in place, and the regs make provisions for offences applicable in cases of breaches of those obligations. These regs also make a consequential amendment to the schedule of the passenger information regulations as a result of implementing the policy for fully vaccinated amber list country arrivals. The next set of regulations, SR 2021 number 214, the Health Protection Coronavirus International Travel Operator Liability and Information to Passengers Amendment number 3 regulations came into operation again on the 19th of July 2021. These regulations made changes to the Health Protection Coronavirus International Travel Regulations 2021 and the Health Protection Coronavirus International Travel Operator Liability and Information to Passengers Regulations 2021. These regulations were made to exclude arrivals who had been in France in the 10 days prior to arriving in Northern Ireland from claiming the fully vaccinated traveller status as a result of data that showed an elevated risk of imported variants of concern from France. In effect, this created an Amber Plus country category. It also introduced a consequential provision whereby the requirement for an operator to check that a passenger claiming the fully vaccinated status can provide evidence, and that it does not apply in the case of an operator of a relevant service which commenced in France. The next set of regulations, 2021 number 218, are the Health Protection Coronavirus International Travel Amendment number 5 regulations. They came into operation on the 26th of July 2021, and these regulations made changes to the Health Protection Coronavirus International Travel Regulations 2021. In effect, these regulations introduce a new exemption category for seasonal agricultural workers who can claim an exemption from post-arrival testing and from self-isolation whilst undertaking the exempt activity if they have travelled from an amber list country. This exemption was included in the Northern Ireland regulations in 2020 but no longer required. However, it was reintroduced at the request of DERA and the demand for such workers in Northern Ireland, bringing us into alignment with the UK Government. The next set of regulations are 2021 number 225, the Health Protection Coronavirus International Travel Operator Liability and Information to Passengers Amendment number 4 regulations. They came into operation on the 2nd of August 2021. And these regulations make changes to the Health Protection Coronavirus International Travel Regulations 2021 and the Health Protection Coronavirus International Travel Operator Liability and Information to Passengers Regulations 2021. These regulations were made to introduce a revised definition of self-isolation to describe the various contexts, i.e. self-isolation at home following travel from an amber list country, managed isolation in a hotel following travel from a red list country, or self-isolation in relation to the workforce testing. It also created the new category of Amber Plus list countries, determined following the assessment of data of variants of concern by the Joint Biosecurity Centre. If a fully vaccinated traveller arrives from an Amber Plus list country, they are not treated as if they had arrived from a Green list country. They also extend the fully vaccinated traveller policy so that travellers who are fully vaccinated in the EU or USA and who arrive in Northern Ireland from an Amber list country are treated as if they had arrived from a Green list country. These regulations also establish a workforce testing regime for certain categories of arrivals to Northern Ireland. Those arrivals must now undertake lateral flow device workforce tests after arrivals, as opposed to booking PCR post-arrival test kits, which would be duplicating testing that is likely already being carried out within various industries. This aligns with the testing regime introduced in England earlier this year. They also amend the exemption for specialist aerospace engineers or workers so that they are exempt from the requirement to book and undertake post-arrival testing. And finally, these regulations require travel operators to ensure that a passenger provides evidence of relevant vaccination as described in Schedule 2B to the principal regulations where they have declared the fully vaccinated exemption. The next set of regulations are SR 2021 number 230. They are the Health Protection Coronavirus International Travel Operator Liability and Information to Passengers Amendment number 5 regulations, and they came into operation on the 8th of August. These regulations made changes to the Health Protection Coronavirus International Travel Regulations 2021 and the Health Protection Coronavirus International Travel Operator Liability and Information to Passengers Regulations 2021. These regulations were made to Add Georgia, La UN, Mayotte and Mexico to the NI red list, owing to an increase in risk of variants of concern. Removing Bahrain, India, Qatar and United Arab Emirates from the Northern Ireland red list, owing to a decrease in risk rating of said countries. Add Austria, Germany, Latvia, Norway, Romania, Slovakia and Slovenia to the green list, owing to a decrease in risk of variants of concerns. And to remove France from the Amber Plus list, thus leaving no countries on that list. Provided an exemption for UEFA guests and Villarreal fans travelling within a managed bubble using chartered and private transport from self-isolation and post-arrival testing, thus allowing them to attend the UEFA Super Cup held in Belfast on the 11th of August. They allow students travelling to Northern Ireland from a red list country to attend a university course to complete managed isolation in university accommodation rather than in the managed isolation hotel. They require operators to ensure that a person who declares an exemption within the passenger locator form provides evidence to support their declared exemption status, and also provides a defence for operators where they have alleged to have failed to ensure that a passenger possesses evidence of eligibility for an exemption on the passenger locator form to show that the passenger presented a document purporting to be appropriate evidence which the operator could not reasonably have been expected to know was not appropriate evidence. And the final set of regulations, SR 2021 number 241, the Health Protection Coronavirus International Travel 2001 Consolidation Amendment number 6 regulations, came into operation on the 30th of August 2021. These regulations made changes to the Health Protection Coronavirus International Travel regulations, and in effect they were made to make amendments to Regulation 10 of the Principal Regulations to clarify that the requirement to self-isolate does not apply to a fully vaccinated Amber List arrival, that is, a person fully vaccinated under the UK vaccination rollout programme or fully vaccinated in the USA or EU. They added Montenegro and Thailand to the NI red list, owing to an increase in the risk of variants of concern. They added the Azores, Canada, Denmark, Finland, Liechtenstein, Lithuania and Switzerland to the green list, owing to a decrease in risk of variants of concern. And we also tidied up the principal regulations by removing the exemptions for the UEFA Super Cup invitees and UEFA Super Cup Villarreal attendees, which had now expired. We also amended the definitions of approved private test and approved private provider to substitute the reference to the Department of Health to the Secretary of State for Health and Social Care. And finally, they amended paragraph 4.3 of Schedule 6 to the principal regulations to correct a drafting error. I trust that's been helpful to members. Debbie and I are happy to take any questions that members may have in relation to these regulations. Thank you.
Thank you, Carol. In relation to, there's been reports during the week around compliance and levels of non-compliance with travel regulations. What's your assessment of the situation locally in terms of how many cases or percentage-wise are believed to not be complying with the travel regulations?
Okay, well, we collect data, Chair, from the police and the border force in terms of non-compliance with the requirements to arrive in Northern Ireland, having completed a passenger locator form and having undertaken pre-departure testing. And the numbers of fixed penalty notices issued in recent weeks have been very low, suggesting over 90% compliance. In terms of unvaccinated passengers who are from Amber List countries who arrive in Northern Ireland, we have a contract with PHE in relation to a call service who would contact the arrivals on day 2 after arriving into Northern Ireland. And if the call handlers are unable to make contact with these people to check that they're self-isolating, then there is a referral to the police, and they go out and check that these people are isolating. So we've got quite good enforcement and monitoring measurements in place, Chair.
Thank you, Pam.
Thank you, Chair, and thanks for letting me in there because kind of relevant to your question and indeed the answer. I wanted to ask in around how many offences have been recorded in respect of seeking to exploit measures applicable to fully vaccinated travellers, and have there been any instances of fraud?
Well, in terms of the data, in terms of we've collected data on the fixed penalty notices, and so far we have had only 7 offences recorded, 7 fixed penalty notices issued by Border Force in terms of non-compliance with purchasing the post-arrival testing packages and and arriving without having completed a PLF. In terms of fraud, can I just clarify what you mean by fraud in terms of proof of vaccination status?
Yeah. Yes.
Okay. Well, in terms of proof of vaccination status, then obviously we have the uploading of the, if you like, the vaccine passport on the PLF, and operators can check that that's the case. So in terms of what a traveller returning to the UK has to provide would be the QR codes that proves the vaccination status. In terms of arrivals from the EU, they have to prove their vaccination status by the EU digital certificate equivalent. And in terms of arrivals from the USA, they would have to show their CDC card, which proves that they have the vaccination status. And because they don't have a digital solution as such, they would also have to prove their residency details as in the USA. So that's how we would capture that. So there's very little scope for fraud at this moment in time.
Okay, thank you. Could I ask you another question on, it'd be good to have specific updates or assessments on how effective the isolation measures affecting international students and seasonal workers, aerospace engineers have been. So by way of an example, could you tell us how the managed isolation process for international students operated in practice?
Well, this is a new thing that has come in. Obviously, it's to take into account for the tranche of international students coming from red list countries for this term, if you like. So there has been arrangements made with Queen's University for specific rooms in their halls of residence to act as managed quarantine facility. And so that I'm assuming will kick off quite shortly because the term is starting. So that's as far as I understand. I'm not managed quarantine isn't my policy area at the moment, but that's the arrangements that had been made in that the students would arrive. If they're arriving in Northern Ireland, they would be then expected to be transported to travel to the managed quarantine rooms, if you like, within the Queen's accommodation, which would be separated from other students.
Okay, thank you.
Okay, thank you. And just to remind members, we do need to be out of here by 1:20, 1:25 maximum today, and we may lose broadcasting. So at 1:20, and we may need to pause slightly for that. Go ahead, Jerry, please.
Thanks, Chair. Thanks for the run through. I asked Nigel about this earlier, so apologies to Nigel. Around the Villarreal exemptions for the UEFA Super Cup final, I think it was, and the exemption for self-isolation. Has there been any work done about potential increase in cases from that event? And then also the self-isolation exemption for amber list countries. I mean, what is the consideration, obviously, around people who are I think people are doubly vaccinated are no longer required to self-isolate from the regulation change, as I understand it. I mean, what is the work or view on, obviously, people who are double vaccinated can still get the virus, albeit not as severe, in terms of protecting people. So has there been any work? Are you aware of research or some data on that? And if you are, could you point us where it is? Thank you.
Okay, so in terms of the learning from the UEFA exemption, we have, from the regulations point of view, I wouldn't be privy to any work that's going on. I think Nigel McMahon in the previous session talked about that. It would be more in terms of the contact tracing aspect of that, and not at the risk of sounding like I'm bouncing this back to you, not in relation to the regulations that I'm responsible for. I know that in England they did some learning from that, so I think they may have done some research in terms of any possible transmission rates following from the UEFA events that happened over in England, but I'm not privy to that data, unfortunately. Okay. And your second question was in terms of people who are doubly vaccinated and contracting coronavirus subsequently?
Yeah, and you're exempt from self-isolation, the exemption for self-isolation, and I think a requirement to take a test, if I'm correct.
Okay, so an individual who has been fully vaccinated currently under the UK vaccination rollout programme, or under a vaccine approved in the EU and the USA, approved in the UK, if you like, if they are fully vaccinated and they have proof of that, then they will be exempt from self-isolation and the day 8 testing. They would still be required to complete a passenger locator form, show proof of negative coronavirus test, a pre-departure test, and undertake a day 2 PCR test under current rules.
Okay, thank you.
Okay, thank you, Carol and Deborah, for that, and we can now go into our formal consideration of the SRs, but appreciate your attendance and your contribution to the committee. Thank you.
Thank you so much.
Okay, members, we'll now formally consider each of the SRs in turn. All of these SRs are subject to negative resolution procedure, and the Examiner of Statutory Rules has not yet reported on any of these SRs. So, number 18 is SR 2021/189. Have members any further issues to raise in relation to that SR? No, thank you. If not, then can I ask members to agree formally that the Committee for Health has considered the Health Protection, Coronavirus, International Travel, Operator Liability and Information to Passengers Amendment Regulations 2021, and subject to the report of the Examiner of Statutory Rules, has no objection to the rule. Are we agreed? Great, thank you, members. SR 2021/213. Have members any further issues to raise in relation to this SR? No, thank you. If not, then can I ask members to agree formally that the Committee for Health has considered the Health Protection, Coronavirus, International Travel, Operator Liability and Information to Passengers Amendment No. 2, Regulations 2021, and subject to the report of the Examiner of Statutory Rules, has no objection to the rule. Are we agreed? Agreed, thank you, members. SR 2021/214. Have members any further issues they wish to raise in relation to this SR? No, thank you, members. If not, then can I ask members to agree formally that the Committee for Health has considered the Health Protection, Coronavirus, International Travel, Operator Liability and Information to Passengers Amendment No. 3, Regulations 2021, and subject to the report of the Examiner of Statutory Rules, has no objection to the rule. Are we agreed? Agreed, thank you, members. SR 2021/218. Have members any further issues to raise in relation to this rule? If not, then can I ask members to agree formally that the Committee for Health has considered the Health Protection, Coronavirus, International Travel, Amendment No. 5 Regulations, and subject to the report of the Examiner of Statutory Rules, has no objection to the rule. Are we agreed? Agreed, thank you, members. SR 2021/225. Have members any further issues wish to raise in relation to this SR? No, thank you. If not, then can I ask members to agree formally that the Committee for Health has considered the Health Protection, Coronavirus, International Travel, Operator Liability and Information to Passengers Amendment No. 4, Regulations NI 2021, and subject to the report of the Examiner of Statutory Rules, has no objection to the rule. Are we agreed? Agreed, thank you, members. SR 2021/230. Have members any further issues they wish to raise in relation to this SR? No, thank you, members. If not, can I ask the members to agree formally that the Committee for Health has considered the Health Protection, Coronavirus, International Travel, Operator Liability and Information to Passengers Amendment No. 5, Regulations 2021, and subject to the report of the Examiner of Statutory Rules, has no objection to the rule. Are we agreed? Thank you, members. SR 2021/241. Have members any further issues to raise in relation to this SR? No, thank you, members. If not, can I ask members to agree formally that the Committee for Health has considered the Health Protection, Coronavirus, International Travel 2021 Consolidation Amendment No. 6 Regulations NI 2021, and subject to the report of the Examiner of Statutory Rules, has no objection to the rule. Are we agreed? Thank you. Okay, members, we now have a remaining 4 SRs at agenda items 25 to 28. I would seek members' agreement that we defer those. I'm just checking with Clerk. We have the ability to defer these to next week, and given time pressures, would members agree that we consider these at next week's meeting?
Agreed.
Yeah. Thank you, members. Okay, so moving along then, members, to any other or correspondence. What will we defer?
It's up to you, Chair, whether...
So correspondence items then, could I suggest that correspondence items be addressed via email as we have done on previous occasions? Any issues, the clerk will issue an email to members and members can respond to that on correspondence items. Thank you.
Chair, see just quickly on that, can I come in?
Yes, Orlia, go ahead. Very briefly.
Yeah, just I know we're deferring it, but I would just like to cover it in public session. There is an important piece of correspondence contained within the PECs. It's about the Public Accounts Committee, which I also sit on. We've prioritised and we're doing an inquiry into addiction services, and that's taking place at the end of October. And there's a letter there asking members if the committee wants to be involved and to be kept updated on that inquiry. So listen, I mean, you know yourselves that the issue around addictions and the increase in drug deaths and alcohol deaths, alcohol-related deaths, it's costing the economy, the health service over £900 million a year. So I think it's a really important one for the committee to stay close to if members are in agreement.
Would members agree with Orlia's proposal? Yeah, thank you. Okay, members, I refer members then to the forward work programme at tab 30.1 of the pack. Are members content to note that forward work programme? Yeah, thank you. And members then moving on to any other business? No other business today. So members then, date, time and place of next meeting. Our next meeting will be on Thursday, 23rd of September at 9:30 a.m. in the Senate or via Starleaf. Thank you, members, and please take care. Thank you.
Programme signed. This is the Northern Ireland Assembly Senate Chamber.